Good morning, the Ridge Medical Practice. Vicky speaking.
Try not to bite my finger off, okay? I need it for work.
And do you know why I would like you to stop smoking?
Because of my chest, I know.
Do you feel like harming yourself?
Not right now, but you never know, do you?
It's funny how you've been well all through your school holidays, and then the day you go back to school, you get poorly.
Your sugar now.
Pre-diabetic.
Yes, you're getting a gold star.
Woohoo!
Morning, Emily.
Morning.
Come in.
Oh, hello. Hi. Are you ready for us?
I am, yes. I just dazed off and gone on to something
It's
else.
quite all right.
Come in. Hello.
This is Betty.
Hi.
And I'm Jane. I'm looking at a daughter-in-law.
Oh, right, OK. So they seem to say you had a few bits and pieces that they wanted us to
it
check.
started with that about 5 years ago.
Oh.
Then that.
Right.
And I've had put Germaline on every day, but it hasn't moved it.
Right.
And then I've got all sorts.
You have, haven't you?
Yeah. And I've got one behind there and that itches. Can you see it?
Yes.
And then I've a few. One on my shoulder there.
And then on your face, this
Oh,
one.
these are mostly, I won't get rid of these. I'm not bothered about
You nearly forgot about that one.
Puss look.
And these, I mean, these are driving me mad. There's one behind me here. And that cheek there. And the touch on my forehead there.
Oh, goodness me.
But I want really want these on my face. I mean, my beautiful face, you see.
So can I have a look at them? Sorry, this is a bit of gel.
Of course you can.
Yeah, and a bit
I
of a
just
light.
want rid of them on my face.
I've been feeling,
Poorly?
yeah,
Yeah. Any high temperatures? Have you felt hot?
Yeah, she had a temperature this morning.
Did it wake you up in the night?
yeah, as well,
What kept you awake?
in my throat.
Was it really sore? Okay. Shall we have a look at it? Come on then. Were you going back to school today? Is this a big drama to get out of school, do you think? It is a drama to get out of school.
Better not be Halima.
No, in here. Let's have a look. Oh, your temperature's high. 38.3. Right, give me a big R. R. Oh, it does look sore in there. You go and sit down. So you have got a bit of an infection in your throat there. We'll give you some antibiotics and you can go back to school tomorrow.
Okay.
How's that?
Good,
Good for Dad.
good.
It's funny how you've been well all through your school holidays, and then the day you go back to school, you get poorly. I believe you. That thermometer doesn't lie. Drink lots and lots of water, because your lips look a little bit dry. We don't want you turning into a raisin, do we? What if you wake up tomorrow morning and you're a raisin? Can't go to school then, can you?
Don't we?
Put you in some scones. That's a good idea. All right, darling. I'll see you next time. All right. Cheers,
take care. See you later.
No worries.
Sorry, what made you sort of come now? Have you suddenly got a load more?
I've been
or
telling
what?
the doctor about this for years.
Yeah.
And they said you better go see a dermatologist.
Yeah. What about these on your face? How have they sort of progressed over the past 6 to 12 months?
Sometimes bits drop off.
Yes. That's not anything to worry about. But still, we want to try and treat them, and I'm just trying to think how's the best way to do it. So you've got a lot of different bits and pieces.
Yep.
I think that they are mostly sunlight damage. I was wanting to get the advice of our consultant, and she's here next week. I know it's a bit inconvenient to come back, but I'd just like another brain to help me suggest what to do, whether there's some that she thinks she's a bit more worried about and perhaps we should take a little sample, and whether there's others that she'd just be happy to put some creams on that will irritate. So they'll go quite nasty and crusty, and then it starts to come back beautiful again, but without surgery.
It'd be nice if it were ointment for my face.
I know.
Yeah.
Well, it wouldn't be nice while it was working because it'd get really crusty and
well,
it'll
it
look a
don't
right
matter.
mess. No, but it doesn't matter
Yeah.
because after a couple of months it'll look beautiful again.
Oh,
so
yes.
that's what you want, isn't it? It's a full facelift. Okie doke.
Thank you very much.
You're welcome.
Lovely.
Okay.
Thanks for your help.
Thanks. Take care then. So I'll see you next week.
Yes.
Turn right. Turn right.
Bye.
This way.
Oh, I'm going the wrong way.
I've got a really, really, really big spider. Oh, wow, it is a big one. Look at it.
Oh my God. It's a monster shell.
It is. Now I need something to shimmy underneath. Come on, mate. Ooh, look how big he is. Whoa, oh my God. Absolutely huge. I'm gonna just go. Let's go for it. There you go. Ugh.
Hello, good morning.
Hello, Mohammed.
How are you?
What can we do for you today?
Well, basically, I need some balm cream for my leg.
And what's the cause of that?
I fell and scraped my leg on a door.
Right.
And it flared up and everything, you know.
Okay,
I mean, that's 2011.
So quite a long time ago.
Yeah. It's still there, the marking, because
Yeah.
when I'm walking, especially when I'm doing a bit of exercise, the blood's flowing.
Yeah.
Then it gets really itchy. I mean, as you can see, the skin gets really dry.
Yeah.
And it starts flaking off.
And has that colour and appearance changed over the last few weeks, few days?
No.
No, fine. Have we tried any steroid cream on that?
No, I don't believe we have.
Why don't we try that?
What will that do? Will that help the itches?
Steroid creams reduce inflammation. So when things are irritated,
Right, okay.
then it kind of calms them down. So I'm hoping that that's going to improve the itching.
The other thing, right, any chance of getting a full MOT done on myself?
So you're 51. Have you had, anyone over 40 is entitled to a one-off NHS health check MOT.
No.
Have you had it?
No.
So you can book in for that.
Do I need to book it?
Yeah. But just use the words health check, NHS health check.
Right.
And then what they do is they check your blood pressure, cholesterol, height, weight, give you a kind of once-over.
Right, that's fine then.
Unless there was a particular concern that you had, you just,
I mean,
not,
to be
not
honest
just
with
the
you,
general MOT, but...
Yeah, I mean, to be honest with you, I do get some pains in my chest now and again.
Really?
Yeah.
Oh, you should tell me about that. Don't just have an MOT. No, you should share that with me, please. Tell me.
Yeah.
No.
You do the exercises, don't you? Yeah.
Exercises are the way forward.
Are you doing any stretches? Weird movements, yeah, okay.
Can you just pop your arms out again for me?
And your legs rotated a bit, and she cried. Oh, dear me. I'm tired, Jenna. What have you been doing?
Nothing.
Nothing.
Sometimes doing nothing makes you more tired.
It does.
Come in. Hello, come in. Mr. Hussein,
It is.
come and have a seat.
Thank you.
I have a student with me as well today, if that's okay.
That's no problem. I seem to be getting a lot of pain. It's been like just over about a week and a half. It's like all back of here, all my arm, and it seems to be, like within the muscles. I mean, as soon as I press, I can feel the pain.
Okay, and anything trigger it that you can think of? You've not moved house or lifted heavy stuff or...
If I did do it, I mean, I'm more right-handed. I would have done something with my right hand, not my left.
Okay, let's have a look then, shall we? So, if you just stay sitting for a minute. Is it tender up here?
Yeah.
Whereabouts? Is it
Well, it's more...
more at the back?
Yeah.
I could do to have a look at this shoulder. Do you think you could take that arm out your T-shirt? I'm conscious of you.
And can you tell you the truth? When I'm sat down not doing the thing, you can feel the throbbing more, you see. That's, really tender,
So can you lift your arms up in front of you?
Yeah, I mean, I can lift them up. I can feel the pain hurt more when I try to lift it up more high.
Can you lift right up to the top? And that's hurting here in this muscle?
It's hurting all the way along here.
Okay. Can you lift your arms out to the side?
Yeah, I mean, I've tried all this at home, just to kind of try to ease them off.
So from looking at you, you can put your arm back in your your T-shirt now. From assessing you there, I don't think this is the shoulder joint. I think you're right. I think it is a muscular pain. Perhaps you need to have a think about what could possibly have caused it, but the main thing I would say is give it some time. Give it a couple of weeks. And if it's still there in sort of 4 to 6 weeks' time, come back and see us. But I would expect it will go.
But what would cause it going all the way right down?
So you've pulled muscles. You've pulled the muscle here in the chest, and you've also pulled some muscles in your arm. How? I'm not entirely sure, but
this is what I can't
seems to
understand.
me like you've strained some muscles, maybe by lifting a bag, or I don't know. It can be quite a fine balancing act, getting it right between not being dismissive and listening and understanding patients' concerns. In primary care, us general practitioners are gatekeepers, and it's okay to watch and wait sometimes and not jump to investigations straight away.
It just kind of hurts a lot, you know.
But I wouldn't
so-
worry. I'm confident it'll settle. Okay.
Yeah.
All right then.
Okay, my love.
Okay.
Thank
Thanks
you.
very much.
Okay, my love. Okay, thank you.
Take care.
Okay, my love. Thank you.
Bye-bye.
What about these chest pain?
It's just sometimes it's difficult to breathe, you know, on the left side. When I'm breathing, you know, it's painful.
It just catches you?
Yeah, it just
when you're
catches me
breathing?
now and again, yeah.
What about if you're really pushing yourself physically, rushing around?
I haven't really had much of that, to be honest with you. I don't get pain. It's like, you know, you get a stitch.
Oh, okay.
You know, it's that type of thing, you know what I mean?
Okay.
And when I'm breathing, you know what I mean?
Right.
It's quite painful to breathe.
And how long has that been the case for?
About a couple of months now, really.
Do you smoke?
I do smoke, yes.
Okay, all right. So do you have a kind of chronic phlegm, cough, or?
Just normal white phlegm.
Right, okay. Yeah, it doesn't sound like angina or heart pain.
Right.
It could be a bit of lung pain, or it could be a little bit of muscular pain.
Right.
I don't think the MOT is going to help that. But book in anyway.
Yeah.
Because they check you for diabetes, they check your cholesterol, check your blood pressure.
Yeah, I mean, my mother's diabetic and so is my father.
Yeah, and you're a man and you're 50-ish.
Yeah.
And you're Asian. All of these things put you at higher risk of having heart disease. I mean, obviously the fags won't help.
No, they don't actually. You know, I mean, I'm trying to reduce them as much as possible, and hopefully, you know, come off them. But it makes it very difficult.
Okay, excellent.
Right, thank you very much, Dr. Youssef.
My pleasure.
Thank you.
Bye.
See you.
What? Oh. Mrs. Kirby, please. Have we a Mrs. Kirby? Oh, bloody hell. Mrs. Ingham, although you're not on my paper list for today, my computer has all of a sudden woken up rather groggily, and your name is on my computer list. Emily, come and let's both fight with the computer, shall we?
Computers are great when they work.
Here we are. Come on in.
Hi, Tatiana. I'm Dr. Carr. Nice to see you. Come and sit down. So I believe I'm seeing you for something on your knee. Yeah, okay. How long have you had that for?
I have a couple years already, but before I even came here, but it was very little and it's now growing more.
Yeah.
And that's why I'm all the time with babies. I'm staying on the knees
okay.
and it's make pain for me.
Yeah, of course. Do you mind if I have a closer look?
Yeah.
The only bit you'll feel is a little needle going into the bottom of it and putting some medicine underneath it to numb it. After that, you shouldn't feel anything at all. We then make an incision over the top of it and it should just come out, and you'll have 2 stitches which will dissolve themselves over the course of a week. And you might be left with a little scar where it's been, and otherwise...
Maybe better.
Maybe a lot better than what it is now. Yeah, definitely.
Yes,
happy to get rid of it? Good. Right.
So if you make yourself comfortable on here...
Do I need shoes off?
You're okay. It's fine. How old's your baby?
Oh, 8 months now.
Oh, how nice. Is it your first one?
No, third one.
Third one, wow. How old are your other 2?
6 and 2.
Oh, you are busy
Very
lady
busy.
then. Yeah. Are you nervous? Don't be nervous. It'll be all right.
So I'm Susan Towers. I'm a GP, but with an interest in skin problems. That's why it's Sister Eve, wasn't it, that sent you here?
Yeah.
Linda.
Linda.
Okay. She said that you've been having trouble with your face for a few years.
Yeah, it's been after the birth of these twins.
We're blaming them, are we?
Yeah. No, actually, everything was right. Everything was okay. My face was really good. But it's been last 2 years I am having this problem.
Right.
And I am having it just before my period, every month. Sometimes every month, sometimes every other month. Can you see this spot?
Yeah.
All around my face.
Yeah. Is this a good day, is it?
Yes, it's really, really good.
Well, we can definitely do something for this. This is acne, and in some people it does start later on in life. It usually starts in the teens, but in some people who are unlucky it can start in the 20s, 30s, even 40s, and then it's much more stubborn, unfortunately. So sometimes we need to use quite strong treatments. The problem that you've got is caused by your grease glands being too active. They're making too much grease, and the gland itself is getting blocked. Okay. So when there's too much grease in a gland, sometimes you can see it like a blackhead.
Yeah, blackhead, whiteheads everywhere.
Whiteheads, exactly.
Yeah.
And then sometimes the gland sort of stretches and stretches and gets very inflamed and red, and that's those red lumpy bits that you're describing.
Everyone this pop.
Yeah.
Oh my God. Sometimes at night,
Really
sometimes
sore.
in morning.
What I'd like to suggest to you is this strong treatment called Roaccutane, which really shrinks the grease glands and makes them small again. It's the only treatment that does that.
Okay.
One thing that's important is you can't take this if you could be pregnant or planning a pregnancy in the next few months.
No, not at all.
No, not at all.
No.
Because this tablet always damages a baby as it's growing.
Okay.
So that you would be advised to have a termination. So it's really, really serious. Okay, so that's one thing.
Yeah.
It can also affect your mood in some people. It's very important for patients to understand the potential side effects of prescription drugs. It's a bit of a contract between us and the patient. We need to think about whether it's safe for them to take that medication, if there's other things that might interact with it. Most medications are taken safely and without any significant side effects, but if there's some particular medications which we think have a potentially serious risk for an individual, then it's important that we talk about those. Sorry, I just have to ask that personal question again. If you're sexually active, you must use 2 methods of contraception because this medicine so often damages growing babies. But just bear it in mind. And each time you come, we'll need to check a pregnancy test. So don't be upset that we're asking you to do a pregnancy test. It's just what we've got to do. Okie doke. So we'll be seeing you probably in 4 weeks.
Okay, thank you.
You're welcome. Thanks. Take care now. Bye-bye.
I'm just going to test it. Tell me if this feels sharp.
No, I feel that you touch, but not...
Yeah, nothing sharp. That's fine.
No.
You'll feel a bit of pushing and pulling, and that's normal.
Yeah.
You know, Tatiana, I'm opening this up now, and it doesn't look like a cyst. It looks like a bit like if you got something in your knee, like a piece of wood or metal. So
Like something inside.
Yeah. Often people get like a little chip of wood or a little chip of metal under their skin, and then you can form a granulation tissue around it, and it forms this hard surface like this. So I suspect that's what's happened. And it's in one of those positions where you're likely to kneel onto something, and it...
Yeah, when you touch, it's like little ball inside.
Yeah.
You know? It's not...
It's okay, we'll get it all out. It's not a problem.
You okay?
It's nearly done, yeah.
Is it hurting?
No, no.
All right.
It's all right.
Really doesn't want to leave you, Tatiana.
No, it likes being in there.
It's quite at home here. Right, it's gone. We're just going to put the stitches in and then we're done. All that for that. You have a nice smooth knee now. You'll have a bit of a bruise where it's been, but it's all gone. And Karen, I'll just put a little dressing over it, and that's that.
I'll just lower the couch.
Thank you very much.
No problem. In a week's time, it'll look beautiful.
Okay, thank you. Thank you.
Hello.
Hi, are you okay?
I'm fine, thank you. Sorry to keep you waiting. How is your dad? How is he feeling?
That medication you give him isn't working at all. So we've had a lot of down days. He don't go out or anything now. He's just enclosing himself in house.
Okay.
So from last time we seen you, it's just got worse.
Okay, he doesn't want to leave the house.
Yeah, he tries to enclose himself.
Okay.
He's fell more into depression and anxiety and feels more worthless.
When you say worthless, is he trying to harm himself?
Yeah, we had to ring first response unit, and they said they're going to send him an appointment out.
About 4 times a day they were ringing.
Yeah, they said they're going to send him an appointment out for mental health team because he needs to be assessed. But I told them we had an appointment with you today, and they said that it'd help if you could refer him to mental health team as well.
So they want me to
Yeah,
refer
as
him to
well,
the
yeah.
mental health.
Yeah.
Okay. Do you feel like harming yourself?
Not right now, but you never know, do you?
Okay.
Anything could just trigger it. It's what goes on. It's what the voices he's hearing in his head and stuff.
Oh, is he there? Is he there? Oh, he is, and he's got blue eyes.
Brain surgery. Well, there's no brain there.
It's naughty, isn't it? Hey, look at you. Come in. Right, so which one's Hardy?
Hardy's this one.
Yes.
He had been diagnosed with hand, foot and mouth.
Yeah.
So that's...
How is he doing after that now?
He's not been too well, you know. He's, it doesn't seem to be picking up. And, like, his mouth is always sore. And it's still, like, I can see a few spots in there.
So is he eating and drinking?
He's not back to his normal pattern of eating and drinking since the hand, foot and mouth.
Yeah.
But when he does eat, sometimes he'll complain like, ow, that hurt.
Okay. Did he have any ulcers or any skin problems anywhere else when he had this?
He had some spots on his
What
hands.
about
They've
his
all
feet?
cleared up, and on his feet.
And if that's all
There's
better
one
now?
little scar left,
Yeah.
but it's all cleared up.
Can you take his top off for
Yeah.
me? Hardy, can I just have a listen to your chest, sweetheart? I know it's not nice coming to see the doctor, is it? Good boy. His chest is lovely and clear. I'm just going to check his temperature quickly. I'm just going to pop this in your ear, sweetheart. It shouldn't hurt. That's perfect. Can you open your mouth for me, darling?
Go ahead.
Ah. Ah. Stick your tongue out, like really naughty. Be really naughty and go,
How do you go like this? Good boy.
Ah.
On that side as well, I saw the spot. Don't know if you can see him there.
I'm going to put my finger in your mouth for 2 seconds. Try not to bite my finger off, okay? I need it for work. Can I just have a feel, my darling? Does that hurt?
Where's it hurt, Hardy? Oh.
That's fine. That was good because he opened his mouth. He's got a tiny, tiny ulcer in the back.
Is it just
yeah.
the one?
Just the one that I can see. The throat doesn't look inflamed or anything. I can't see anything that worries me. So it can take a bit of time for these ulcers to get better, especially the ones in the mouth. Have you tried to use anything?
Bonjela.
Yeah, and is that helping?
Not really.
It's the only thing that we can really recommend for
Yeah.
kiddies that age. You probably know this
Yeah.
already. So I'd advise you to carry on using that Bonjela. But if he's still not right in the next couple of weeks, then just bring him back.
Okay.
They're all very good, your kids, aren't they? Is it an act?
A cover up.
What do you want me to do for him today? Because I can speak to the first response, okay? If he's feeling suicidal,
I think what we need to do is possibly if you could refer him to mental health team for mental health team to assess him personally rather than on a form.
Okay, I can do that, okay? Are you happy with that? Yes?
Yeah.
Okay. Will you be there for him?
Yeah,
and will
there's
somebody be on
families
him?
watched all the time, yeah.
I hope you understand the
out,
reason
yeah.
I'm asking
Yeah, no.
this. And we need to see him again after about 4 to 5 weeks because we are increasing the dose for him.
Yeah, that's fine.
Reasonable?
Yeah.
So we'll see him and I will refer him to the mental health team as well. Happy with that?
Yeah. Yeah.
You agree with that?
Yeah.
Yes?
Yeah.
Because he doesn't talk much.
Because he's really low. We can't let him have sharp objects around just in the kitchen to cook just in case because he gets things in his mind and stuff. So
we'll just do what we have planned?
Yeah.
Is that okay?
Yeah, that's fine.
Is that? Yeah? All right. Then.
Okay.
All right.
Thank
then.
you very much.
Thank you.
Thank you. Bye.
I like doing this. Is this a geeky thing that you like to do?
No, I like doing that as well.
It's quite
therapeutic.
Yeah. So there's 4 number of scripts and 4 on each thing, that's 16 in it. What's 12 times 4?
12
times 4?
48.
If you wouldn't have been here, I'd have used calculator on there. I would have been like that.
Bless you.
Hiya, come on in.
Hiya.
Medication review, that right?
Yes.
And how are you feeling in yourself?
Okay.
How many do you smoke then?
I don't know, it varies. When I'm working, I don't smoke, you see.
Right.
Obviously, can't smoke in work, but I do.
What's your
obviously, when I
job?
get lunch. I work at warehouse at distribution centre.
Right. Okay.
I used to work somewhere else, then I got sacked, so.
All right.
But that really does the atmosphere in me.
Made your chest worse, did it?
Made my chest worse. Yeah. But this is dry.
Okay. So your blood pressure's up a little bit. You see that you'll always be a smoker?
Probably.
Yeah.
To some degree.
And do you know why we'd like you to stop smoking?
Because of my chest, I know.
Have you tried to stop?
Not really.
No. Can we give you some help to stop? To try to stop? What do you think? And what would get you to that point where you think, I'm going to have to stop now?
I mean, if my chest got that bad.
Yeah.
Like, no.
Yeah. But if we know your chest will end up that bad, if you carry on smoking.
So I should...
and it usually takes
stop.
people, averaging about 7 attempts to stop. So you've just got to keep trying to stop. And the message really is that if you don't stop first time, doesn't mean you'll never stop. Just keep trying to stop. Right, my suggestion is just maybe start you on 1 blood pressure tablet and come back and see me in about 3 to 4 weeks, and then we'll make sure that you're okay on that tablet. But I'd like your blood pressure to be a bit lower. Is that okay?
That's fine.
And do come back and see me.
Yes.
Yeah.
Don't worry, I'll come
Don't
back.
sleep in.
Oh, what sleeping? I never sleep in.
That's all right.
Once my alarm goes off, I'm up.
And have a think about a few of the things we've just been chatting about.
I will do.
And then we'll set up a plan for the future when I see you next time.
Right, okay, thank
Cheers. You take care.
Yeah, you too.
See you, Paul.
Okay.
Pauline.
Sorry, I was in the ladies.
Is it working?
Sorry, yeah, oh yeah. Oh yeah, I was in the ladies, so I didn't get it. Sorry.
I'm putting it back. Right, I've got
Student again.
so pretty here. A doctor,
Oh,
one of our new
doctor, hello.
doctors who's just learning the ropes.
Oh, bless you.
Right. Pauline.
Yeah. First, there's 2 things. First one, say that still going really well with the tablets. I still feel anxious, still not sleeping well, and I still get moments of just feeling numb. I don't know, I just need advice.
So at first, when you first started the tablet, they helped?
Yes, they did.
They help with
yeah,
the
for the
sleep.
first couple of nights they help.
The fact that you have noticed a positive difference is really good, because usually we say allow it 4 to 6 weeks.
Yeah, so it's been 4 weeks I've been on them now, I think. Still not getting off straight away, but then when I do go off, I have a really good sleep, so that makes a
that
heck
must
of a
make you
difference.
feel
It does,
better.
it's wonderful. The other thing, I've got ulcerative colitis, and I don't know if it's a coincidence, but 2 weeks ago I had a colonoscopy, and since then my tummy just hasn't been right. I've had constant diarrhoea. I spoke to the IBD specialist nurse, and I went to the hospital Monday, took up some stool samples, and they took some blood samples. Still haven't had the results of those back yet.
So before the colonoscopy, they'll have had to give you some bowel prep, won't they, to clear you out? I wonder if it's that then that's sort
Well, it could
of
have been.
aggravated
Yeah,
things.
exactly. But it's never... I've had quite a few colonoscopies, obviously, and I've never reacted to it in this way before.
No.
And
That
it's
was
just coming
sensible.
out of me like sludge,
Yeah.
really, you know. It's just not formed at all. The problem is I had to come home from work last Thursday with it because I just couldn't work. I travel on the bus, I don't drive, so of course I
It's
can't...
access to the toilets. It's not pleasant, is it?
No, that's the thing. I mean, I wouldn't dare go for the bus because, you know, it comes on urgently and I have to go. So really I need a sick note, please, for
Yeah.
another week just to hopefully get some results back and get back to something like normal.
Of course we'll give you a
Thank
note.
you.
Yeah.
It's just never gone on this long before, you know. It is what it is, isn't it, unfortunately? There's nothing I can do.
You did the right thing by phoning the nurses, so hopefully they'll pick your message up and they should have the results back by the end of today.
Yeah, hopefully, yeah.
I mean, I know they're busy, aren't they? But
that's lovely. Thank you for your time again today.
All right
Much
then, no
appreciated.
worries.
Thank you.
Take care.
I will, and you. Bye-bye.
Bye-bye.
Bye.
My mum wants to get a dog. I said, who's going to look after that?
So I've just got a dog and he's only 7 months. Labrador, yeah. They're just greedy, aren't they?
How's your little doggy?
He's all right.
Oh, have you got enough of him now?
No, he's been a little bit naughty this week.
Oh.
I smell something right weird. Have I stepped in something?
Oh, my first ever picking up dog poo experience, which was quite a big thing really, the first time. And he did a poo on a bramble, a sloppy poo.
It's not me, is it?
But there was someone behind me, so I couldn't ignore it.
I'm funny.
Coming in. Hiya, Mr. Russell.
Yeah.
Hi, it's Dr. James. Nice to meet you.
Oh, I've sat down enough. I've sat down enough. I can't
Do you
sit
want to
down.
stay standing up?
Yeah, if you don't.
That's fine, yeah, I'm cool with that. How can I help you today?
I've had a crick in my neck,
Yeah.
but I've also got a bad back.
Right.
I don't know what's happened. I took my dog. I went up to hospital a couple of weeks ago because my dog went through my legs and dragged me over. I'd badly sprained my leg.
Mhm.
It was in that much pain I couldn't walk on it. But I didn't mention my back, but my back's just got worse and worse and worse, and it's really sore and I can't sit down.
And how long ago is it now?
About 5-6 weeks.
Oh, right, so it's quite a long time.
It's quite a while ago.
So can you show me which point it's most tender on?
It's mainly this part here.
Okay, I'm just going to gently feel down the middle of your spine first.
Just
Okay. Is it there as well?
Yeah, that's it.
Sorry,
That's one.
sorry. And you're able to just lay down on the couch here? Now just let me know if you feel any pain. Right, where's that?
That's just a box.
The bottom there.
Bottom.
About this side? Same place?
Yeah.
I'll let you jump off then, just nice and slowly. Jump off's the wrong word. Just gently step up.
So when I breathe as well, that hurts.
It's all spasmed up, isn't it? And what your body does in response to any pulling injury on your back is it thinks, oh no, that's my back's important, I need to keep it stable and the muscles go really tight. It's almost a bit like a whiplash injury, you know, when you jerk forward and then you get really stiff neck. It sounds like the injury you've had is a bit similar like that with the jerking with the dog. So we could use an anti-inflammatory and that would help bring down some of the pain and some of the tightness a little bit. And then the other thing is, what do you think about seeing a physiotherapist? Is that something you'd be interested in doing?
Yeah, I'll have to do.
There's a drop-in physio here on a Wednesday lunchtime. You can just come in and see, and they'll give you like a one-off kind of work over and give you some exercises. There's your prescription. Okay then.
Cheers.
Take care now, yeah. All the best. You're all right with that. Take care now.
Thank you. See you later. Bye.
Bye now.
Bye-bye.
Come in. Hiya.
Good morning.
Raymond, come on back. How's things going?
All right as such. The rolling pains have gone, but I've still got bad stomach ache. I noticed about a month ago when I went to toilet to poo,
Yeah.
the water was turning an orangey colour. And yesterday when I went,
Yeah.
there were some streaks. I don't know if it's blood or not.
Right, okay. And are you going to, when you go to the toilet, are you going more often, or is it just once a
No,
day?
it's
normal?
twice a day. I usually
Once
go
or twice?
twice a day, and
Okay.
usually first thing. in
And
the
how's your
morning.
weight doing?
All right, as far as I know.
You
I don't think I've
You don't
lost
think
any.
you've lost any
No.
weight or anything?
No.
And we've got your blood due today, haven't we?
Yeah, I am had chance.
I know
to
it
be
don't
able-
matter, so-
With work, I am had chance.
Well, I think the
go.
fact that you think you've probably had some blood, I need to examine your bottom end, if that's okay.
Right. Yeah, no problem.
And then that changes the position a little bit. We might end up referring you for further investigations.
Okay.
So do you mind if I do the bottom
No,
end? That's great. So if you just have a lie back on there for me.
I'd not thought anything about it. I just thought it was me poo turning water.
Yeah.
It's not clots of blood or anything like that. It was just with me noticing it being streaky yesterday.
Yeah. So what you'd need to do is probably just undo your trousers and your underpants and then turn over onto your left side and lift your knees up to your chest. Is that okay?
Yeah, that's no problem.
Great. I'll just get some gloves on. You had this done before?
No.
Looking forward to it? Nobody's ever said yes yet.
No.
There you go.
With a cough.
Yeah.
Did you say she's got a cough?
Choking.
Oh, Jesus. Oh, ow.
Hello, sorry about that. You broke up a little bit. Can I help?
Great stuff, that's us finished. Just hang on a second, I'll get out of your way. I think the fact that you've got this ongoing grumbling abdominal pain and the fact that you've noticed probably some blood, we ought to refer you on for bowel investigations.
All right.
Because that means having a look at the bowel all the way around, up from the bottom end.
Right.
And what we're thinking about is making sure there's no polyps. So these are little growths in the lining of the bowel that can bleed.
All right.
And sometimes those polyps can be early signs of cancer in the bowel.
Yeah.
And that's the thing we want to be picking up and making sure that we're not missing. So even though it may well all come back all normal, I think it's the right thing to get on and get those investigations done. Is that all right with you?
That's fine, yeah.
Right, we'll make arrangements for that to happen. What they'll generally do is a colonoscopy examination right round the bowel.
Right.
Make sure it all looks clear.
Okay then.
All right.
Thank you very much and thank you for
nice
your time.
to see you again. No, don't worry,
Thank you.
Raymond, thanks. Well, I'll just walk you down to get your bloods because Jess is waiting for you.
All right.
We can get you sorted out in one go, can't we?
Yeah, sorry.
Yeah, you follow me.
Sorry about that. I had to go and review a patient next door. Absolutely fine. Right, so I'm Dr. Khan. How can I help?
What it is, I can't walk on my heel on my right foot.
All right, yeah.
Don't know what I've done. So I thought, I'll leave it a couple of weeks, I'll take some anti-inflammatories, get it down, and it hasn't gone.
Yeah.
I've had ice on it, everything, nice baths, no one's
working.
taking it now.
Let's take a look. So show me where you get the pain.
Just right in that area, just in that full area there. So every time you touch it, alert.
Yeah. And just remind me what you do for work. You say
I'm a drainage operative.
Are you on your feet a lot?
All day.
Yeah.
All day long.
Okay. So I think you've got a condition called plantar fasciitis. Have you ever heard of that before?
No, never.
Right. So let me just show you what I mean. So this is the plantar fascia, that lining of tissue that runs under your foot.
Yeah.
And that's the bit that can become inflamed.
That's what's hurting me.
Yeah, yeah. And you can see it's exactly the place where you're getting the pain, really. So you've done the anti-inflammatories and the resting side of things. The next step is really trying to get that more elastic again by doing some exercises, which I'll show you. If the exercises with the painkillers don't work, the other option is then to think about injecting it with a cortisone to try and loosen it up, which is a really powerful anti-inflammatory.
Okay.
So you can see these pictures here.
Yep.
We have to stretch it out really. So you lie down with a cloth, lie on the floor, and you pull your toes
Pull your
back.
toes towards you.
Because what that plantar fascia links into is the tendon at the back of the heel as well. So say this is the foot that's the problem.
Yes.
And you pull in there, and what you feel is a stretch all along there.
So
and
basically all you're doing is stretching your calf muscles.
yeah, because you want to pull it up really.
So that, yeah, okay.
The other thing is this. This is a really good one, but you use a tennis ball rather than a rolling pin.
Yeah.
And you just roll your foot back and forth over a tennis ball. And if there's any
Like a massage?
Yeah. The thickened bit will start to break up and then soften. So I'll just print this off for you.
Brilliant.
It's a really common condition, so don't worry about
I
it,
won't
and it's
worry then.
easily treated.
Right, thank you very
All
much,
right.
sir. Yeah,
Okay,
cheers.
thanks for
Ta,
coming in.
thank you.
Cheers. Take care.
Janet thinks I've lost a pound. And to say I've been trying this week, really.
That's good then.
That's all right, isn't it?
When you've lost a pound and you've been really good, you're like, a pound.
Yeah.
But then when you've not been that good, you're like, a pound. Like it's never acceptable.
I remember I went and I'm like, I've had a really bad week and I'd lost £6. I'm like, has your scales got problems?
What? That's never happened to me.
I have no idea what were going on. How did I do that?
How have you been? Good. Come and take a seat. Last time we weighed you was November 2017. You were 13.10. You're now 12.11. So
Wow.
stone off. Is it anything to do with cake?
Yes, I have stopped baking.
So you've had all your bloods done for your diabetes?
Yep.
How do you think you've done?
Well.
Okay.
Because I'm very careful.
Okay. Your sugar now.
Pre-diabetic.
Yes. 39.
Nice.
Yeah. Cholesterol 2.5. Excellent. Kidneys excellent.
Good.
You're getting a gold star.
Woohoo.
Right, you're on a lot of tablets, aren't you? Losartan for your blood pressure. Lansoprazole for your stomach. Bisoprol. Amitriptyline. Yeah. Sitagliptin for your sugar. Olive oil for your ears. Pregabalin.
For the pain, joints.
Yeah. Laxido.
Yep.
Constipation. You've got inhaler. Fibrogel. Ibuprofen. Manivec. Torvastatin for your cholesterol. Mebeverine for your tummy. Mood tablets.
Yes.
Okay, so we might need to take a tablet out. I'm just doing yours now. Please stop glimepiride 2 milligrams as hypo risk. And excellent diabetes control.
Ooh, I'm gonna go eat all the ice cream I can find. No, I'm kidding.
Did they ask you to bring a urine sample?
No, I keep forgetting also.
Okay. If I give you a bottle and a form, will you be able to do it?
Yeah, I'll be able to bring it back.
All you need to do,
just put it.
Leave them in there, put your urine in there, drop it back at surgery.
you.
Oh, it's lovely to see you.
Yes, and
Everything's
tell your
really
boy
good.
Happy birthday for
I
me.
will
All
do.
The best people are born on our birthday.
So let's see you before your birthday, yeah?
Okay.
Kidology.
Next year.
Yes.
Wow, a whole year.
Yeah, a whole year. If you find that sugar starts to creep up, come back sooner.
Yeah.
But I think you're going to be fine.
You look after my
And you.
for me.
See you later.
Yes.
I'm going to Bye. Go that way.
Oh, okay.
Bye.
Bye-bye.
Let me get the dog for you. Bye-bye.
Cheers, mate.
Take care. Bye.
It's nice meeting you, love.
Nice
and
meeting you too, honey.
Have a good life. Stay as you are. Thank you.
You too.
Are we talking cancer?
It can be a sign of cancer.
Yeah.
Is that you?
Yeah.
Blimey. I'll never look like that.
There we are. Okie doke.
It's a good job I've got no kids being it.
The Ridge Medical Practice, Karen speaking.
Are we talking cancer?
Well, sometimes it can be a sign of cancer.
Yeah. Before I was a very calm person, and recently, when I go on my social media, I see something, it just gets to me, I just get angry.
Is that you?
Yeah.
Blimey. I'll never look like that.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I know.
There we are. Okie doke.
It's a good job I've got no kids meeting.
Morning, Ebony.
Morning.
I nearly died this morning, Rihanna. I was running, and there was these 3 sheep that I'd managed to get out of the field onto the dirt path. And then I was like, oh, God, fine, just move out of the way, I'll just walk past you. So I ran, and then they charged at me.
Was it thought you were coming after them?
Well, it wasn't, I was just running innocently. I was listening to TLC.
What were you listening to?
The Creep.
Come in. Hi, love. Here you come. Hello. Take a seat, ladies. So, hello, how do you? My name's Debbie. I'm a nurse practitioner. What can I do for you?
My leg hurts on my kneecap over here.
Right.
It all started since last evening.
Right.
She can't bend it properly or straighten it up.
OK. And then when she woke up this morning, she came downstairs still?
Yeah, but
Right.
but she can't straighten it up.
No, I can see she's limping, isn't she?
Yeah.
That's quite
Do
an
it
important point, because usually with children, if it's something and nothing, it would have gone by the morning. What did you do yesterday?
I just was playing and I did some work and I don't know how it started.
You point to where it hurts for me. There. OK, now we need to have a look at it, and I'm just going to take your temperature. What year are you in?
Year 2.
That's a big grown-up year, isn't it?
Yeah.
Right, what I want you to do is I want you to take your shoes off and I want you to take your tights off. You're lovely, aren't you? Eh? Take your coat off as well, because it's... Right, come walk on this floor. Walk over to me. Oh, darling, does it really, really hurt?
It hurts a bit.
Right, can you try and put your foot down? Does that hurt more?
It's just when I'm going to put my legs straight, it starts hurting.
Come in.
Hi, Dr. Beanie.
Hello.
Assalamu
Come in.
alaikum. How are you?
Come in, come
Good to see
in.
you. Thank you.
Come in.
Thank you.
Let me help you to the chair.
Okay, thank you.
So
Thank you.
just to your right, another step.
Thank you.
There we go.
Thank you.
Nice to see you again.
Nice to see you, thank you. I think I've got a fissure or a similar kind of problem,
Right.
with hemorrhoid.
Yeah.
But basically, it's been going on and off for the last 2 or 3 years.
Right.
And it's really, really uncomfortable.
Sure.
We've tried the gamut of ointments, quite a
Right.
number of things, and it's not shifting.
Yeah.
So I wonder if we could try something drastic.
What were you thinking?
Could you try an injection, do you think?
Is there any bleeding?
Well, that's a tricky question, being visually
Because you
impaired.
can't see it, can you?
Mm.
No. Have you ever seen a specialist about them?
No, I've had a CT scan and stuff done.
Right, OK. What was that for?
I think just because I was experiencing a lot of bowel problems.
At the moment, when you're pooing,
Yeah.
then, does it really hurt?
Sometimes it does, but certainly afterwards, there's quite a lasting stinging and
Sure.
itchiness, and
Sure.
it's really awful.
Yeah, no, of course. Now, I know you've been examined recently.
Yeah.
It'd be good if we had another
No, that's
look.
fine. That's absolutely fine.
Is that OK with you?
Yeah, no, absolutely fine.
OK, all right. Let's pop you on the couch. So... Oh, I was going to come get you. I was going to come get you. So, the couch, can you feel
Yep,
it
got
there?
it. Thank you.
That's the foot of the couch.
That's fine. Okay.
Let me just draw this round. Well, while you're there, just let me get some gloves.
Yep.
Oh, wow, you're already on the bed. You're like lightning quick.
Well, no time to waste.
You see, because you've seen so many specialists, you know the exact position,
Oh, well.
your knees up, it's all done, isn't it? You're some kind of expert patient. So, OK, that's good. On the outside, I can't see any lump. Yeah, there is a little bit of a...
Pustule.
Yeah, oh, well, no, it's just a little bit of bowel.
Yeah.
There's no abscess there or anything like that. Let's get you decent.
That's right, thank you.
So it does look like it's continuing irritation like before. Have you been getting things over the counter?
I've been tried stuff like, Sudocrem.
I don't think Sudocrem's going to cut it.
Something needs to cut it, I tell you. Thank you.
There we go.
Thank you.
Good lad. OK, so why don't we try a kind of general cream
Right.
for the moment? Also, something that's got a little bit of steroid in it, as well as some local anaesthetic.
OK.
And then if it's not helping, what I would be thinking is something targeting specifically
Right.
the possibility of a fissure.
Right.
Is that all right? So that's the prescription.
Thank you.
There we
Thank you
go.
very much.
Good.
Thank
Do you
you
want to ask me
very
anything else?
That's it, I think.
No? Lottery numbers? No?
Well, I'm sure if you knew that, you wouldn't be here, would you?
Are you ready? First I'll start at your feet. No pain there? No. No? Does that hurt?
If it's hurting...
Just say, darling, I want you to say...
No, it doesn't.
I'm just going to move your hips. Does that hurt?
No.
This knee is a little bit swollen
Yeah,
here.
it is,
It is
it
a
is.
bit swollen here. Up you get. There's a good girl. Put curtains round you and then you can put your tights back on. I know you're not going to like this, Mum, but I would say we are very, very careful with children's joints. So I think she needs to go up to A&E for them to have a look at her. Because swelling and pain in a joint when there is no fall, in children often it's just their body responding to a virus or something like that, but we can't scan, X-ray, examine, but they do that up in A&E.
Yeah.
Is that
thank you.
okay?
Yeah,
Put
that
proper
would be
tights
great,
on the... You're a mystery, aren't you?
Yeah, I was wondering as well, how could this happen? Because all the time she was in home. I mean, she didn't go outside, even for cycling.
Yeah. Do you like your bike? Do you ride it without stabilisers? Good girl. That's great, isn't it? What colour is it?
Pink.
Right, so all the best, my love. Get to the bottom of it. See you later, ladies. Bye-bye.
Bye.
Hiya.
My blood test level at 5 to 10.
What name, please?
Kelly, K-double-L-Y.
Brought the sunshine out with you.
Certainly did, and you're looking dapper with the
Oh,
sunshine as well.
thank you.
Yeah, it all blends in together, doesn't it, for both of us, look there. Made your day, look at
Yeah, absolutely.
Hey, another thing, you're sweet as a nut as well.
Thank you.
Come and take a seat, because we chatted on the phone, didn't we? You've been having some difficulty with this pessary, haven't you?
Yeah, she has a pessary. There was a bit of blood loss, wasn't there, Mum?
I'm losing blood all the time, really.
Yeah. How long's that been going on for? Was it just when it was changed, or was that happening before it was changed?
It was happening before.
Yeah.
Yeah.
Is it sore?
I feel sore, yeah.
So what I wanted to do was have a look and see if we can work out why you're bleeding, because sometimes pessaries can rub a bit inside and they can cause a bit of discomfort.
Right.
But the other thing is we need to just have a look inside to make sure there's nothing else that might be causing the bleeding that might warrant a referral to hospital. So shall we have a look and see?
Yeah, you can, yeah.
Yeah. So let's just get you up here. OK, you all right there? Let me pull this round. So, I'm going to put a hand on your tummy first. They're cold, though, on my hands, I'm afraid.
Not to worry.
OK, so I just need you to relax these knees, OK? I think I'm going to take this pessary out today.
OK.
So that I can have a look and so that we can give you a bit of a break inside, all right?
Thank you.
Right, let's just have a little look. You all right?
Yeah.
OK. There we go. You okay there?
Yeah.
Yeah, there is quite a lot of blood in there, isn't there? It's difficult to see exactly. Yeah, right then.
You all right, Mum?
Yeah, fine.
Come here, love.
Right, so looking inside, there is quite a bit of red blood, actually. It's not easy to see any obvious place where it's coming from or any obvious cause for it. I think it's most likely that it's that pessary that's caused irritation inside.
Oh,
but I can't be certain, and I think the best thing to do will be to ask the gynaecologist up at hospital to see you soon.
Right.
OK? Because sometimes bleeding after the age of the menopause can be due to other things.
Right.
Problems in the womb or problems in the vagina. I can't see anything there, but, you know, it might be deeper inside.
Yeah, OK.
Sometimes it can be a symptom of cancer, so that's why I want hospital to see you.
OK.
Yeah? And see you soon. Get it over and done with. Yeah?
OK.
Let's get your trousers.
OK.
There we
Oh,
go.
you're lovely. Thank you very much.
That's all right. So,
thank you.
My job now is to write to the hospital and
Right.
see if they'll see you. Like I say, it'll probably be within a couple of weeks, but I think it gets it over and done with, doesn't it?
Yeah. Are we talking cancer?
Well, sometimes when you have bleeding after the age of the menopause, it can be a sign of cancer.
Yeah.
So I think it's better to be safe than sorry and go be seen up at the hospital.
OK.
OK?
Yeah.
I'm going to give you some cream as well, though, in the meantime. There we go. OK? All
Thank
right,
you very
Mama.
much. Thank you very much. You've
OK,
been
you
lovely.
take care.
Thank you.
Thanks for coming in. Thank you
Thanks
for bringing
ever so
your mum in.
much.
We'll get the door. There you go.
Right, thank you.
OK.
It's cancer.
Mum, she didn't say it's cancer. She said it could well be the cause of the pessary. It's been left in 3
Yeah.
months over.
Or it could be cancer.
Yeah, so you've just got to...
I know, Linda.
You've just got to wait and see.
I've got these 2 students with me today.
Oh, yeah.
OK, fire away, ladies.
So how can we help you today?
So I'm just going to lift up. And if the student just has a feeler. So if you just...
Jaundice people, I always thought, how can you tell if someone's jaundiced? And
Yeah.
then someone came in, I thought, right, I can
That's
I can
jaundice,
see.
exactly, Simpsons.
Yeah.
If you just flick that like that, just gently. Feels like a guitar string.
If you feel mine, I've got 2 good ones there and there.
Oh, yeah.
Yeah, so that's what you're feeling for, essentially.
Good job. OK, well done.
I really enjoyed it, actually. It was satisfying as the first one, yeah.
Cheers to the 2 of you.
I'll drink to that as well. Cheers. Hello.
Morning.
Hello, Mrs. Attar.
Hi.
Come in. Right, come and sit down. Hello. Right, Smee, do you want to come and sit down as well? OK. So do you mind if Smee tells me a little bit about why you come in? Thank you for speaking to our students, by the way.
it's fine, yeah.
Great, thanks.
Okay, so this is Miss Actor. She's come in with 2-3 week history of hot pain, starting in the elbow. She's tried using some ibuprofen gel, some painkillers, that made no difference. With the pain, it's probably more so on the lateral side.
Yeah.
She's got Sturgeon syndrome, and she was told that sometimes she gets some rheumatism as a side effect. I was thinking that possibly it could be more so rheumatoid.
So, you mentioned rheumatism because she mentioned Sjögren's syndrome. Any other
I think
ideas?
it could be a trapped nerve as well.
Could it also be golfer's elbow?
Yeah.
Tennis
Tennis
elbow.
elbow.
Yeah, right. OK, so now we're on the right
Yeah.
lines.
Yeah.
OK, because she's got tenderness.
No
idea. So, the other name for tennis elbow is? Lateral epicondylitis. Yeah? OK. It is so important that students come to GP surgeries on placements to learn. What they see here, the interaction between patients and their doctors, the conversations that we have with families can't be taught in classrooms or from textbooks. So seeing that firsthand, there's no substitute for it, really. So what might she be doing on a daily basis that could cause this?
Helping the daughter.
Yeah.
It's all your fault.
Oh, look at that face.
I work in a school. I help children with disabilities. I help them a lot. And obviously this one, she needs help as well. So,
What's your name, darling?
Khadija.
And what does your mum do for you to help?
She pushed in the wheelchair and she helped a lot.
Does she? So now we think you've got a condition called tennis elbow or lateral epicondylitis. Now we've got the diagnosis, we need to come up with what we can do to help. So she's tried ibuprofen gel, she's tried ibuprofen tablets, and they are certainly options.
Steroid injection.
Right, now we're talking, because that will give you probably the quickest relief, really.
I would prefer something quicker, yeah.
Do you want it now?
I don't mind it. If it helps, because it's got to a point where it's just annoying.
Yeah. Right, let me draw it up.
So what do you think? Marks out of 10?
Yeah, come on, Khadija. How did they do? Not me. I'm 10. Go on. What are we going to give Eleanor first of all?
9.5.
9.5. That's not bad, is it?
That's a good score.
What about Samit?
Same.
9.5. Oh, I think
Yeah,
you
you always got to leave a little bit for the challenge.
Yeah, I like that. That was fun.
Right, sharp scratch. And with tennis elbow, you want to try and cover as much of it as possible. And I would just fan a little bit out. Timmy, just press that down for me, so that's we're all done. How was that?
That's all right.
10 out of 10?
Yeah.
What do we reckon, Khadija? Come on. Yeah. Throw me a bone. 10 out of 10.
She's always having a bone.
Hello.
Hello.
Are we all right?
You look very tan.
I agree. Do you think?
Yeah.
I'm still Menorca tan. In the summer holidays, they made me do this CCG video about the sun safety with children called Slip, Slop, Slap, about putting on sun cream. And there was me, like, really tanned. I'm so not the right person to do this. Really.
That's so funny.
Hi, I'm Dr. Tatham.
Hello.
Hello. Right.
Oh, this has been going on for so long now.
Right.
And it's just basically, I started last year in May with a problem in the top half of my back, in between my shoulder blades, when I sort of try and like bend over a tiny little bit and breathe in. It's really sharp pain. So I tried everything. I've been for acupuncture, I've paid for physio, I've paid for sports massages, I've paid for a chiropractor, I've tried naproxen, I've tried tramadol. Nothing was even masking it. The neck pain that is something that I've had ongoing for probably about the last 10 years of my life. It's like a really hot, intense, sharp pain down my arm. What I get around here is a hot, stabbing, dull, constant, aching pain.
Right. What's your main worry about all this?
That it's not going to go away. It's yeah.
Show me if you want.
Doctor.
As long as it's accurate. A bit like Brad Pitt.
Well, you've got a strange growth coming out the top of your head at the minute, so I can't say that's particularly accurate. It gets me down.
Okay.
It makes me ratty with my kids.
Has this stopped you doing anything in particular?
It stopped me doing upper body exercises now. I can't do lateral pull downs or shoulder raises. I can't do anything.
Yeah.
This is what my back did look like.
Oh, yeah.
3 years ago.
Is that you?
Yeah.
Blimey.
I'll never look like that.
I can tell you that for nothing. I want to have a look at your back.
Yeah.
So I'll just go and get a chaperone, all right?
Yeah, okay.
2 seconds.
Yep.
Right, then. Right, this is Adi. So, just take that top off and we'll have a good look at stuff. Right, can you just point out to me where you're feeling that pain now?
It's just all there.
In there, right. Right, can you twist round to the right? Oh, it's stiff. And twist round to the left. Right, push that wall over for me. Don't actually, I'll end up in trouble, but pretend. Does that seem to aggravate any of your symptoms? It does?
Yeah.
Right, OK. Follow me, so go out to the side with your arms, and if you get any pain anywhere, just tell me where it is.
You know. All
There.
down there, yeah.
Right. Pop your top on, thank you. OK, so what I think this is it's the muscles between your shoulder blades that aren't quite right. So if you want a proposal from me, it would be that I get you some NHS physio and...
I've done all the muscle building stuff like that before, so I know how to strengthen the muscles in my back.
I know,
so I
but
just
it's
think,
slightly different.
I know, but...
It's slightly different.
I don't know, I just feel like... I think I have had physio for this. If you look back on my record 10 years ago, there's some... I just feel like I'm just going through the motions with it. I feel like
I understand.
Do you know what I wanted to get today? I wanted you to come and refer me for an MRI scan.
A lot of people do.
Yeah.
And I understand why people want the scan and feel as that's going to give us the answers. But from what you've told me today, I really don't think it's going to further our journey whatsoever. An MRI scan would show us when something is broken or misaligned in the back. In most cases of back pain, that's not the case, and the pain results from the way we use our back or misuse our back. And so an MRI scan wouldn't demonstrate to us anything having gone wrong, and therefore is often very unhelpful.
I would be amazed if hospital physio sorts this out, because it's been, like I say, it's been
I will tell you
5
now,
years in the
6
making.
sessions of hospital physio isn't going to sort this out, OK? But it's going to take some months of you doing it to really notice the difference.
OK.
I've got a lot of sympathy for patients who come to us with an idea about what treatment that they should have. But as gatekeepers to the NHS, we really do have to keep a handle on what we refer patients for. What I'm going to do is leave you with an open appointment to come back, and then we can talk about what the next step is, which may be imaging, but we'll talk about that then.
All right.
Right, OK. Can I keep that for my notice board? No, that's very good of you, thank you. Nice to meet you.
My hair is so short.
Short?
Yeah.
It's long. My hair's short.
But look, like, it's just short.
Hi there, I'm Linda Eves. How can I help?
I've been getting really bad migraine headaches all this side, and I can't like lift my head up.
So is it like a throbbing kind of a headache?
Yeah, like I can't drive my car.
Okay.
I can't get up.
Yeah.
Like my eyes are burning. I feel very, very tired, lazy, moody.
It certainly sounds like a migraine.
Yeah.
Have you had migraines before?
No.
Okay.
No.
When did you last have your eyes checked?
It's been a couple of years ago.
All right.
Yeah. I think I need to book a
X-ray. I was going to say. Would you say anything seems to make it worse?
Oh, it's just like general stress. Like I don't know. Like my family's saying to me that you might have bipolar because I'm moody all the time.
Okay.
Like normally I'm a completely different person.
Let's just check your blood pressure if that's all right. Have you ever felt that you might hurt yourself in any way or not?
No.
We have to ask these questions when people talk about their mood. Your blood pressure's fine, OK? It's just, I'd like you to tell me a little bit more about your mood.
I just like feel really, really moody.
Crying a lot?
Yeah, crying a lot. Been like my own world for some reason. Like, you know, like small thing I make it big issues, like in my head.
Yeah.
Before I was a very calm person, and recently, even I'm on the phone to my friends, I've been just like flipping, shouting at them. I just get too scared as well.
Scared?
I don't know, I don't want to go through depression or bipolar and stuff. I just want to be a normal person.
She's scared now, honest. I'm always scared now. Any pain I get, I'm like, I hope it's not sepsis, I hope it doesn't come back.
You nervous?
No, not too bad.
Yeah?
Do they numb me first?
You'll be okay. I'm here to hold your hand and talk nonsense to you in your ear.
If I hate this.
Okay, so just a sharp scratch.
Oh, you okay? You've been really brave, I know you.
I just can't stand it, honestly, I'm not joking, I just can't. No, my life has gone this way.
How are you feeling about it?
We're all right. I'm a little bit nervous now, to be honest with you.
Oh, yeah? Why?
It's your neck, isn't it?
It'll be all right.
I'm not gonna lie, I'm nervous.
You're nervous. Don't be nervous.
Scared.
Oh, don't be scared.
Have a seat. I'm Dr. Tatham. So,
There's only 2 ones that I really want removed, and he said you're only going to be able to do 1 though. But the other one is literally on my leg, and I've caught it, and it started bleeding.
right,
That's the only reason I wanted that one off.
we'll have a look and we'll see what's what.
Right, OK, so you lay back. Right, OK.
I've been dreading this all day. Oh, we're going to actually ring up this morning and cancel it, but my mum shouted at me, so I didn't.
Don't worry.
She had a right go at me.
Are you OK?
Yeah.
Right, where am I looking?
It's just sort of like on my right bum cheek kind of thing.
And where's the other one? Yeah.
That's just there. That one catches on my clothes, but it goes up like a little dried up Rice Krispie. So I've started wearing high-waisted pants now so that it doesn't catch on it.
Well, they're fashionable, aren't they? Are they fashionable?
So,
yes, they are.
Very fashionable.
Right, so
You are going to numb it though, aren't you? I'm not.
Yeah,
I'm
yeah,
not
yeah.
gonna say I'm not going to feel it.
Yeah. Tap.
That's not your needle.
Oh, we're going to say.
Yeah.
No, you get the smaller
Yeah.
one.
We're not that mean. You okay? Don't worry.
Right, roll over onto your side towards Karen if you don't mind. It's a right awkward place, isn't it? There we are. Okie doke.
You okay there?
Oh!
It will sting. It will
Right.
sting.
Oh, no, that's hurting. Oh.
Okay, so if we take a little look at these questions, okay, how often have you felt down, depressed or hopeless?
All the time,
Okay.
honestly.
Do you ever feel bad about yourself or like you're a failure or you've let your family
I feel
down?
down about myself,
Do you?
yeah.
How often have you had any trouble concentrating on things like reading the newspaper or watching television?
Yeah, I don't like watching TV.
Okay.
It just gives me depression more. I don't see things, even like when I go on my social media, I see something, it just gets to me, I just get angry.
This just sort of gives us a baseline score so that as you get help and treatment, whether that's talking therapies with medication, we'll be able to see hopefully some progress over the next few weeks when we look at the same questions again. The best treatment for people who are experiencing low mood is some talking therapies. How do you feel about that?
Can I not get any medication that like lifts my mood up?
Is that what you were hoping for? Is that what you were
Yeah,
expecting?
I need something that makes me better. I want to feel normal, like other people feel normal.
We could try you on a low dose of medication, but I just want to emphasise the fact that it is good to have talking therapies alongside that. Let's settle this migraine down first.
Okay,
that
that's
should sort
fine.
that out. And then let's start on a low dose of something called sertraline. Is that okay? And then we'll be in touch in a couple of weeks
Okay, that's fine,
and see
love.
how things are going. All right? So try that number or that number for counselling, or you can come in and see this lady. Now, for some people with this medicine, they do feel a little bit worse in the first few days.
Okay.
Hopefully not a lot worse, okay? But it's not a quick fix.
Okay, thank you so much. Bye.
Bye-bye.
Bye.
Right. It's a bit sensitive around there. Gonna squeeze my hand.
Oh, she's good
Told
at
my
holding
mum she
hands,
should have
this
come with
Karen.
me.
Oh no, it's my role. What are you normally doing on a Monday?
But I would have normally been at work.
Right.
Okie doke. So, let's sort this one on your waist, shall we? Perfect. So
Right.
this will sting.
Well done. Well done.
I don't know how I can moan about this. I've had tattoos. They hurt a lot more.
Right, here you go.
Okay. Can you feel anything?
It's just a little, like, tugging.
Oh, you feel tugging, yeah.
Yeah.
Nothing sharp.
Okay. Gone.
There you go, not too bad, eh?
Okay.
Okie doke.
Right, last one.
Last one.
Well done, well done. Well done. It'll ease in a minute, literally seconds.
There you are. Worst bit.
It's a good job I've got no kids being it because I don't know how to get food. So I don't want it.
You do it.
Oh.
Right.
There you go.
Is it done?
Yeah.
That was the least painful.
That's good. Save the best for
That
last.
one up my right sweat on.
Have you?
What did you do this weekend?
Went to Aberystwyth.
Was that?
It's in Wales.
You went to Wales?
Yeah, I went on Friday, came back Saturday. Megan...
Came back Saturday?
Yeah, I went to a uni open day with our Megs on Saturday.
Uni?
Yeah.
In Wales?
Yeah. She looked at Banger already, and this is the other one.
She looked at what? Banger?
Banger.
Banger? Banger and Aberystwyth. Am I saying it right?
Aberystwyth.
Aberystwyth.
How can I help?
I've got a leg infection, right leg.
Okay.
I've got 2 lots of antibiotics and it still ain't cured.
How have you got this infection then?
I walked into a road sign.
Okay.
Well, not a road sign, a street sign. Everybody else puts them on a wall. Not a great yarmouth in Norfolk. They pull them out about a foot away from towards the edge. Bright sunny day, I moved over to let somebody pass me on this side. Straight into it. Bang.
Have you had any temperatures at all or anything like
no,
that? You don't feel unwell in yourself? No. And do you feel your leg is red or hot or anything like that?
It is still warm.
Yeah.
Check this off. I've got monkey toenail, actually, now.
And where did you knock yourself in the...
Where it scabs are, just go in.
Just pop your leg down for me, please. Ow. And is this what your leg normally looks like?
No.
It looks more red to you?
It's more red to me. It is on the night. It really flared up and it burns.
Well, it doesn't feel warm the way you were saying.
Back there. Yeah. That's normal.
Are you not feeling breathless or anything like that? You're not feeling short of breath or anything?
No.
Okay, well, there's a lot of water.
It's fluid, isn't it, on that?
Yeah. So I'm just going to give you some tablets for
What
that.
tablets?
Yeah.
Yeah, my wife's had them. She's feeling good in the toilet. Cheer up, might never happen.
So I'm not going to start you on any antibiotics, okay? You've had 2 weeks.
2 lots, yeah.
It's going to mess up with your bowels. It doesn't look too bad to me there, okay? Keep an eye on it. Try to keep your legs elevated. You're not allergic to anything, are you?
On an ex-wife. Best thing I've ever done. We're still friends, and that's as far as it goes.
That's good, isn't it? So you know what you're doing, yeah?
Yeah.
So I want you to keep an eye on the leg, okay? If you think it's getting worse, you need to come back and I'll have another look.
Right,
See you later.
Right, thank you.
Bye.
Open wide, Henna. Stick your tongue out, say ah. You're never really off duty in the medical profession. Staff ask you questions from the girls in reception, admin, and you're always sort of watching out and about.
If there's somebody in the public who might need your assistance, you will do what you can to help them.
It's a 24-hour job.
There was one time that I was waiting for my luggage in an airport and a lady collapsed. She wasn't breathing. There was a defibrillator nearby. After 3 shocks, she did regain consciousness, which was amazing.
So I think the most exciting out of hours incident we've had was the birth of our son, Henry. You delivering Henry.
Daddy was midwife
Out
at
Henry
home.
came.
I was trekking in Nepal, and one of the ladies in front of me tripped and fell and broke her arm. I managed to get a plank of wood and padded it with newspaper, and we used some scarves to wrap around it, and then she was able to walk back to the road to get to the hospital in time.
I'm here.
She wanted Chris dead.
Give us a shout.
Yeah, if you feel poorly, let us know. There was one time at the gym where a man was talking about a rash in his groin and suddenly just pulled down his pants right there in front of everyone.
Give it another week. If you get worse, see doctor. All right, my darling. Drink plenty.
Hello, hi. What can I do for you?
I found a lump under my arm. I say it's the size of a pea. It doesn't hurt, but it's definitely a sore feeling.
You've not noticed any discharge from there?
No, well, it's not like a spot or anything. Finished, I felt the lump. I thought, well, you automatically think about it, you know, cancer, anything like that. So I thought, well, I'll get it checked out by you guys. The only reason I'm really concerned about that is because my dad died of cancer. So whether it's in your genes or if it's, do you know, hereditary, I'm not sure, but I thought I'd get that checked out.
Okay. And what kind of cancer your dad had?
It basically was riddled with it. It was everywhere.
Come in. Good morning.
Good morning,
take
love.
a seat, love. Is it Beryl?
It is, love. Back where, love?
All right, my love.
Right, OK. You wanted to book another appointment, did you, my love?
Any time, any day, love.
I think you'd benefit from some steroids today. What do you think?
You all right, love?
You're right.
All right, love.
Deep breaths, my love. And out.
Hello.
Hiya, love. You OK?
Yeah, yeah.
Yeah.
It's all right, carry on. I feel so sorry for you, love.
It's one of them days, love. Don't worry about it.
All right then, my love.
Thank
you.
See you.
Bye,
See ya.
Amy.
Come
See
on,
you later. See you later.
Ta-ra, love.
In you come, my love. I'm Debbie. So this is baby Dylan. He's 9 weeks old.
Yeah.
And your mum.
Yeah, I am, yeah.
And today Dylan's come for his 8-week baby check. Have you got any more children?
Yeah, I've got 4 at home.
4 more at home?
Yeah.
Wow, so he's your 5th?
Yeah, he's my last.
Your 5th and your last, definitely. Well, we'll talk
Kept trying
about
for a
that.
girl, but all boys.
Have you got 5 boys?
Yeah.
Fantastic. And there is some very rare syndrome that touches your family a little bit.
Yeah, I've not seen any in
But
him,
you've not seen it. Has
no,
any of your
I've
other
not-
children got it?
My eldest and the one just before him.
Right, so
yeah.
it's called Waardenburg syndrome. Yeah.
It mostly affects the hearing.
The hearing, yeah,
but
and
he
some
passed
pigment.
his flying colours.
He's passed his with flying colours, so you know all about that and you're
Yeah.
happy with it. Right, my love, so I want you to take all his clothes off, leave his nappy on.
Hello, chunky monkey.
Hello. Hello, darling. I'm your Auntie Debbie. I'm going to turn my light off now and look inside his eyes.
Sometimes he goes a bit boss-eyed. Is that normal?
Babies, you in the first couple of months often go boss-eyed.
Oh, OK.
His look fine today. Keep your eye on it for 3 or 4 weeks. If you see it again, we want him to come back.
OK, then, no problems.
Just going to listen to his heart. What are we doing to you? Oh, yeah. Right, so his heart sounds are completely normal. He's breathing beautifully. Just check his testicles.
Yeah.
One there, look. One there. He's got both of them down already. So if you dress him, but leave his legs out.
Yeah.
And then I'll get his injections ready while you do it.
Hey, it's a nice one.
So until your oldest child had this syndrome, did you know anything about it, or was it?
My mum's got it, yeah. My mum's fully deaf.
All right.
Yes.
Did she sign or did she live free?
We all sign in the family.
Yeah.
Her mum's deaf, her dad's deaf.
Right.
I'm partially deaf in
Are
this
you
here,
partially?
yeah.
Pop him on your knee when he's ready, my love.
Coming in you.
No need to rush, though. So, the first thing he's going to have is drops in his mouth, and the drops protect him against a virus called rotavirus.
Yeah.
They taste nice.
Oh, OK, that's good.
Rotavirus is a very nasty diarrhea and vomiting bug. Now, then, you'll like these because they're like sweeties for babies. A big bruiser like you should love these. There you go, aren't you clever?
He won't turn anything that goes in his mouth down.
That's what we like, though. These strong babies, there's not like them, is there? So if you put your hands around his middle, I'll deal with his legs. He's going to scream like mad. His
Yeah,
legs are
I'm
going to bleed.
expecting
You're
it.
ready, aren't you? You're a sensible lady. 1, 2. First one done.
I know, baby. Oh, bless him.
All done, darling. There you go. All done. I'll have that in a minute when it's settled. There you go. Get that done. What did the nasty woman do to you? There you go. There you go.
Oh, darling. Oh, bless him.
Where do you feel the lump?
There. Just put your finger right there. Feel it.
Because I'm rubbing off my finger on it, isn't it?
Yeah, it's only so it only hurts slightly if you push on it.
Yeah. It's a tiny, small lump, isn't it?
Yeah.
Yeah. Okay. I'm just gonna feel your armpit if you don't mind. Okay. Okay. Can I see the side as well?
Yeah.
Okay, that's fine. And should we? Yeah, you can put on your shirt. About the lump.
Yeah.
So this lump, I know you said you were worried about cancer.
Yeah.
It doesn't look like a type of lump that we would see with cancer. It's something we call folliculitis. What it means is that we do have hair on our body in different regions.
Oh, yeah.
When one of the hair somehow falls and infection gets entry into the root of the hair, that causes a bit of swelling. That's what it is.
Oh, okay.
So it's nothing but the blockage of the hair root.
Yeah.
We don't need to do anything specific to treat it. It gets better with time.
Yeah.
And most of the time, it resolves within a week or 2 weeks' time.
All right.
Just examine it after a week. It probably would have gone.
All right, brilliant. Cheers.
Thanks a lot.
Thank you.
I'm talking to an 80-year-old this morning. She says, doctor's asked me to book a telephone call. And I went, right, okay. Tell me which day is best for you. And she goes on, this is what I do this and I do. And I go to the gym on a Tuesday. I went, what?
Well, my granddad's nearly 90 and goes to the gym 7 days a week.
She says I'm 80. And I've been going every week for the last 25 years. I thought,
Oh,
you
my
girl.
gosh.
Yeah. Got to go and join them myself.
Mr. Robinson.
Yes.
Come in. Right then.
Yeah.
How are you?
Well, not so bad apart from my leg. The trouble is, you put up with it during the day, but I do stumble a bit with it. But it's at night in bed that's where it's worst.
Yeah.
You know, you get interrupted sleep.
So where exactly do you get this pain then?
Here. It's here mostly, but same as I come this morning, it's going down my leg. Yeah.
Shall we have a look at you?
Yeah.
You take your jacket off.
Yeah.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, 70 years, gosh. Oh, you must miss her.
I do.
Yeah. Do you think that keeps you awake a bit at night as well?
Pardon?
Does that keep you awake a bit at night too, or...?
It's getting up to sleep, you start thinking.
Yeah, yeah. Have you got family nearby?
Yes, yeah.
Can I untuck you?
Yeah.
I do think you look incredible for your age.
Yeah.
You're 93 now?
Yeah.
What's your secret?
Yeah, a pint now again.
Good lad. Right then. Do you get out and do much walking?
Not a lot.
Do you get out the house at all much?
Yeah.
Yeah? You got friends nearby? Good.
Yeah, yes.
Can you feel that?
Yeah. Just downside here.
More that side, yeah?
Yeah.
Just put your leg back down. So you feel it when I press?
There, yeah.
Yeah.
There.
Yeah, so it's right on the outside of your thighs here,
yeah,
isn't it?
yeah.
It does definitely seem more pain in the hip, doesn't
Yeah,
it,
yeah.
that's causing this?
Yeah.
So I think best thing is to try and keep as active as you can. So a little bit of walking will help. Do you think when you're out and about it might help to have a stick? Have you got a stick?
Yeah, I have one.
Yeah, just so you can catch
Yeah,
yourself
yeah,
and just... What we don't want is for you to fall over, do we?
No.
Yeah. So there's this issue of the pain at night. Do you think it might help if I give you something that might help you sleep but might help a bit of nerve sort of pain? I'm thinking of a tablet called amitriptyline that might help you sleep. Should we give it a go?
Yes, if I can put my glasses on.
Oh, yeah, forgot about them. Good job you remembered, didn't it?
Thank you.
There we are. OK. So, I'll give you a ring in 2 weeks, OK? Any problems,
Thank you.
just let us know.
Right, thank you.
Give that a go and see how we get on.
Yeah, thank you.
But I think it's probably that hip, you know.
Yeah.
You've probably got a bit of wear and tear in it, haven't you?
Yeah.
It's had 93 years of use, hasn't it, eh?
All wear and tear.
You take care of yourself, all right? Bye-bye.
Thank you very much.
That's right, lovely to see you. And thanks for sharing that with us as well.
See you later.
Bye-bye.
Sorry about me.
Not at all, not at all. Nice to see you again. I hope I don't see you, obviously, for a long time, but
so do I.
All right then.
Bye-bye. There you are, hold your jumper. Bye-bye. He's lovely.
See you later.
See you. Have a nice time.
I lost my husband end of May. He went in and he didn't come out.
Must have been a
Bit
shock.
traumatic. Yeah, it is a shock.
I got bitten by a dog yesterday.
OK, right.
And he drew blood.
Where is it most sore?
It's hurting in here.
You're such a brave boy.
If I show you pictures of poo on my phone, if that's OK.
Good morning, the Ridge Medical Practice. Vicky speaking.
I got bitten by a dog yesterday.
OK, right.
And he drew blood.
Where is it most sore?
It's hurting in here.
You're such a brave boy.
I lost my husband in end of May. He went in and he didn't come out.
Must have been a
Bit
shock.
traumatic. Yeah, it is a shock.
Have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, all right.
If I'll show you pictures of poo on my phone, if that's OK.
How are you feeling about what happened?
Paranoid. Really paranoid.
Yeah. Morning, Ebony.
Morning.
Leonie. Oh my God.
I'm Susan Towers, a GP, but with an interest in skin problems, so that's why your doctor sent you
I
here.
hope you can help me.
So you didn't have any problems with your skin as a child?
On and off.
What did you have?
Patches of eczema, but then more recent, I've had outbreaks like all down my back, all down my legs, and the biggest problem is my ear. I've had that ongoing for over 12 months now, antibiotics, cream, steroids, anything, and it's just not helping.
Is there any reason why you can think that might have happened? Your job, for example, or any hobbies?
I'd say maybe stress-related. I think age thing, getting older.
You perhaps stress more because you know there's more to worry about, don't you, maybe?
Yes. I've had poor mental health, so I've just been getting myself more well.
Right.
So focusing on my mental health, going to support groups and stuff.
OK.
I've been using hydrocortisone ointment on my ear. It itches. So in the night, I'm waking up and my ear's on fire. So that's what's been bothering me more lately. This is really bad.
Oh, that's nasty, isn't it? Do you colour your hair?
I have dyed it, but I haven't had hair dye in the ear.
It is leaching out slowly over time. That's why it
Right.
fades, and so it can irritate you if you're sensitive. Can I look at... what did you say? Your legs are bad?
What they are on my legs is more scars.
Let me pull this round.
Yeah. These are the recent ones that I've just scarred.
Okay.
I say they're like cigarette burns.
Yeah, you do have a spotty type of eczema, which some people have.
And these are my old
Marks from
scars.
previous, yeah.
But this is why it's bothers me, because it's come back again. No, it's scarring me. I'm not sure if you can see if there's any on my back still, but normally I get them all over my back.
Oh, there is. Okie doke, thank you.
Come and take a seat. So this is a new chap, is it?
Yeah, we're engaged now.
OK, so you missed your appointment yesterday for your B12, is that right?
We got it in the wrong place, didn't we? We slipped up, didn't we?
Anyway, let's see when your last one was.
You won't know anything about diabetic, will you? Do you?
Want to know, yes?
Oh, well, we've come to the right place.
Yeah. Well, I did my blood this morning and I was 17.7.
OK. What is it normally?
One day last week, it came up to 22.
Anything changed in your diet?
No.
You're not having more cakes, biscuits, chocolate, anything?
No, I've been
eating a few sweets, but...
I've been eating a few, but not a lot.
No.
It's telling tales on you.
I know. Because we go shopping and, oh, a bag of sweets goes in straight away.
I wonder who's putting the sweets in that...
Me.
OK. So just be careful with those.
Yeah, well...
Yeah.
Right.
OK, love, yeah.
Shall we do your B12?
Right.
Where do you normally have it?
Either my left or my right.
Do you think this injection now might bring a blood test down a bit?
This is not going to have anything to do with the
ain't it?
glucose levels, no.
No.
So this is like iron deficiency.
Yeah. I
So
see.
she might get a bit more energy.
Yeah.
I could do
She's
with
full
some.
of energy.
Is she?
We go cycling.
Good.
I went cycling yesterday and I fell
Did
off
ya?
on my bike. Look.
Oh, keep an eye on that.
Does
It's
it
all
need
right.
out? Does it
It
need out
looks
on it?
okay.
We're
but
putting
if it,
Savalin on that one.
if it gets more red, more hot, and any swollen, come back and get it checked. But
Yeah.
keep it clean.
Right.
Right, shall we do it in your right arm?
Right.
OK.
There
let's have a
goes,
look.
there goes.
So relax your arm down, OK? You know it stings a little bit, don't you, when it
Yeah,
goes in?
it does, yeah.
Look at you, fella. Can't scratch. It's all right, nearly done. All done. Okie doke.
Thank you very much.
Today. You're welcome. Nice to meet you.
Yeah, nice to meet you.
And you.
Oh, yeah. She's not just a pretty woman, eh, love?
We'll see you again, love.
See you
Right,
later.
bye, love.
Bye.
Your skin surface is supposed to be like a brick wall. with
Yeah.
the brixy skin cells and then the cement in between them. And people with eczema tend to not have quite as good cement as people who don't have eczema.
Okay.
That means the bricks fall off more easily, so your skin tends to be a bit drier and flakier.
Yeah.
You lose water through the gaps, but also things can get in. When something gets through those little cracks and irritates, it irritates you a lot more than it would irritate somebody without eczema.
Yeah.
And that's why steroids are needed, okay? Because they suppress the inflammation. But we don't want to keep using steroids because they're going to damage your skin.
Yeah.
That's why we've got to prevent with lots of moisturiser.
Is it common that? Because people think I've got flea bites and stuff. I've never seen it before.
Well, I've seen it like that. Some people do have a spotty type of eczema.
And why have I only just started getting it?
Stress always makes things worse. We know it affects your immune system.
Right.
Maybe when you weren't so well with your mental health, you didn't look after your skin as well as you do now. I don't know. It's a combination of things usually. But anyway, now you've got to start.
Yeah,
again.
definitely. Better than you fobbing me off, really, because I was thinking it just weren't curable.
It's not curable, it's controllable.
Yeah. Lovely.
So you've got 2 tubs of moisturising cream, so that'll last you 2 weeks. I've given you this quite strong cream called Sinolar C. I've given you loads more than I think you'll need, actually. It should be loads better within a couple of weeks.
Okay. There's hope, isn't there?
There's definitely hope. You're going to get better.
Yeah,
promise.
thank you very much. Thank
You're
you.
welcome.
We have a big problem with his willy with foreskin. Last couple of days he was complaining that it hurts.
Yeah.
And that he feels the pain when he doing wee. And yesterday at school he fell over and he squashed it somewhere. I've been asking him if it was hurting before he fell over.
Yeah.
He said yes, yes.
Yes, OK. Right, let me have a little look at you. Well done.
He come to me yesterday and tell me, Daddy, I have a little problem.
Oh.
Pull his pants down, look, he's swollen and bigger and getting bigger and bigger.
Poor thing. OK, so it's slightly up now. Right, over here onto this little
Chodź,
thing
pani
here,
Sikorka
right,
obejrzy
sweetheart?
rybcia.
Over you come. There's a good boy. All right, then.
Oh, that side is worst.
Is it uncomfortable?
It is hurting.
It's hurting. Yeah, no.
I think he squeezed somewhere here, or,
Yeah, I
or
think
is
he
it
has.
infection or
Okay.
something?
It does look a little bit infected, doesn't it?
Yeah.
I agree. I'd like just pop his things back up for a moment. I'm going to ask Dr. Keris to take a little look at him
Stand
because
in,
that's sort of, well, it's obviously tender, isn't it? All right, I won't be a moment.
Okay.
But it looks like bruised at the base of his peen, like really bruised.
Really?
Like, because they said it was really swollen up.
Okay.
I thought that doesn't look normal.
Right.
So.
Okay, sure.
I don't know if I've been bitten on my eye by something. It's just literally swollen my whole eye up.
And 2 evenings ago, I sat out on 9:45 when it just getting dark. I got bitten by insects.
We're in garden. Chris stood on a wasp's nest. His whole body's covered in wasp stings.
Whatever it was flew on, bit me there, and carried on its way.
Well, I came in last night because I'd been bitten. It happens this time every year.
Oh no! I keep getting bitten by something everywhere, look. I've had one there and one there, but I don't know what it is. It's proper doing my head in.
Right.
I got bitten by a dog yesterday.
OK, right.
And he drew blood. And the police suggested that I come to see the doctor.
OK, so tell me what happened.
I'm walking down the road and there was this woman standing by the car, husband standing there and her son with a dog on the lead, a little rat on the lead, yeah?
OK, yeah.
Suddenly just jumped up and bit me through the leg.
Right.
But I was more shocked.
Yeah, of course.
I mean, I love dogs. I've had dogs all my life, but I've never, ever been bitten by one.
The vast majority of dogs are beautiful, nice
Yeah.
animals, you know. Right, shall we have a look at it?
Yeah. Don't think I can get it out far enough.
It's all these new trendy pants that are all tight at the bottom.
Yeah, look. Oh, I might.
Right.
It actually hurts.
Yeah, I bet it does, because it's bled underneath as well, which is that bruising that you can see there.
That really hurts.
Right, there's a couple of things we need to do. Because he's broken the skin, we need to give you antibiotics.
Yeah.
Any bite that breaks the skin, we give antibiotics for.
Yeah.
We need to give you a tetanus booster as
I
well.
haven't had one of them for a long time.
Yeah,
Okay.
I need the top of your arm for that, so if you can just...
Take me jump.
Yeah. Are you allergic to anything?
Not that I know of.
So this will protect you against tetanus for the next 10 years. So
OK,
that's...
thank you.
Right, just a sharp scratch, sorry. We're all done. That's
Thank you very much.
No problem. And a course of antibiotics to take for 7 days. It's certainly not infected or anything now.
That's good.
It's just about protecting it from getting infected and protecting you from tetanus. 4 times a day for a week. That's you sorted.
Thank you very much.
All right, nice to see you.
And you. Thank you very much.
See you later.
Bye.
OK, I've got Dr Caris in to take a look at Philip as well. All right.
Right, so what's happened then today?
He got that problem with the foreskin.
Right, tell us a bit about it. What happened at school then?
I was running, then I fell down.
You fell down? Yeah. OK. Oh, did you land on someone's leg or someone's knee? Maybe. Yeah. We've got to make you feel a bit better, haven't we? Yeah, what do you reckon? Should we have a little look at you? Are you able to sit down? Right. Can you pull the skin back yourself? Is it going to go back? Show us what you can do. OK. Right, there's some bruising. Right, yeah, a little bit. OK. What year are you in at school then? What class are you in?
Year 1.
Year 1. So how many teachers have you got?
2.
2. Right, can I have a little look down here, see if we can make it feel a bit better? Yeah. You're a good lad, aren't you? Where is it most sore? It's just all over, isn't it?
It's hurting in here.
It's a bit swollen, isn't it? OK, you're such a brave boy. OK, did anybody kick you today?
Yeah.
Who kicked you? It's OK, you can tell us what really happened. It's absolutely fine.
Someone kicked me and then I fell over.
OK, where did they kick you? In this bit?
Yeah.
Pull your things up, OK. I think you're the bravest Year 1 boy I've seen today, definitely. Definitely. Right. I think probably he's been kicked there and that's flared things up a little bit and it's all a bit swollen and that's aggravated the problem. He has got a tight foreskin and he may well benefit from a circumcision at some point, you know, where they remove the foreskin to allow it a bit easier.
I'll do a referral and then they can discuss it with you about whether to do it straight away, to wait and see.
You've been ace. Yeah, such a brave boy. Because he's able to pee, we think we probably need to give him some antibiotics to try and help settle that down. You may be more comfortable sitting in the bath and trying to pee in the bath, you know, things like that. Okay. Is that all right?
Thanks for your
help,
help,
I'll leave you in very capable hands.
OK, thank you.
Any questions?
No, I think we know everything.
Yeah, there we go then.
All right, thank you.
You're welcome.
Bye-bye.
Bye-bye.
All right, see you, bye.
OK then. Bye.
Surrey Medical Practice, Dawn speaking. I'm afraid our system has crashed at the moment. We're not able to do anything. I think it would be the same at our other surgeries as well, yes, because we all use the same system. We are advising people if they could call back in about an hour or so. No, I'm afraid I can't do anything because none of the doctors can get onto the system either. I can't physically get onto the computer to see the appointment system. I would advise you ring 111. As I said to you, before the systems went down, I knew that all the appointments for this afternoon had been fully booked. I'm really sorry, but there's nothing I can do because there's no system. The only option would be to ring us in the morning to try and get an appointment then.
Dorina. Hiya. Come on down.
A bit faster. You know, I feel a bit...
You're still walking quickly enough, though, aren't you? Hey?
Do you not die if I can't?
Yeah? What's been the matter?
My feet.
Yeah?
Here. When I put in the morning, put me here.
Yeah.
I feel like a sponge.
So is it tender?
Oh, yes. Even the painkiller doesn't kill it.
If I press there, is that where it's tender? Yeah. It probably is fasciitis where...
Yes.
It's where the arch drops a little bit.
Yes, but it's the other foot as well, just the same.
Yeah, it's often the same on both feet. Yeah. What commonly happens is if we look at your foot sideways on...
Yeah.
That's your heel bone.
Yeah.
And those are the bones going to your toes. You have this strong...
yes, there.
This strong tendon that goes along to form the arch of your foot. And what that tendon does, sometimes it flattens out and it pulls on the bone here, and it causes an inflammation of the tendon and around that heel bone. That's the thing that's painful. Yeah. What you can do is buy some supports that support the arch.
Oh, my son's bought me two.
And the other thing you can do is you can give an injection to that area.
Oh, no, then I'll try with that.
Do you want to try with that for another few weeks?
See how thing goes.
OK. So you were telling me last time about, because when we're going down to see my son.
Yes, he's still down there, isn't
In Sevenoaks.
Sevenoaks.
Yeah.
He used to be beautiful, but he wasn't very populated. I remember in those days, but it was beautiful, clean, part of the countryside.
And why were you down there again?
Because I had relation everywhere.
So you were a guest of Mary Soames, who was Winston Churchill's daughter.
First daughter.
And you used to go and stay?
Yes, because Auntie, she was the top chef for them.
What year was this? Was it?
In 1954.
Yeah.
Because Winston used to say, oh, Bradford is very dark.
So we'll wait and see how you go with the padding.
Yes.
Another 3 or 4 weeks.
3 or 4 weeks.
Still struggling. We'll reconsider possible injection.
Well, I'll try anything.
Yeah? OK.
Thank you very much for everything. And you look after yourself.
And we'll see you again if you're struggling still with
this. I'm getting old. But no, not
You're still great. Yeah.
Keep on going.
See you later, dear. Bye-bye.
Did you see me at when I was 14? And I thought I looked like a right stunner. I went to my sister's anniversary and she had the album out. So I thought to myself, oh, you looked pretty not bad.
Even though you say it yourself?
Even though I say it myself.
That tall, weren't you?
I know, I was actually tall.
Oh, it still looks like you. You haven't changed a bit.
That's me, yeah. And then look at this.
Yeah, you still, I'm sorry, but you still look good. You were, what, 14 there?
Yeah.
Yeah, you should have seen me up when I was 14.
No, I can't imagine you being chubby at all.
Come on in, have a couple of seats. I'm Dr. Caris. Right, this is Angela, is it? Who have you got with you?
I'm an auntie.
Auntie Linda.
Yeah, they live with me and my husband.
All right.
Mum died.
All right, OK. Right, what's going on?
I'm struggling to breathe again.
All right, OK. When did...
She's been on for nearly 5 weeks now.
5 weeks, all right. Because
She's got inhalers and she's using them, but they're not touching her.
Oh, really? Right. OK, so which inhalers have you got and which ones do you use?
I use that one at night and morning. And that one during the day when I need.
OK. Let's check you out then. Have you had your inhalers today?
Yeah.
And have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, right. Right, let's pop this on one of your fingers, eh? And how do you feel in yourself now?
Just a bit breathless.
A bit breathless, yeah. Because your oxygen level's very good, 99, and your pulse rate is OK. Can we have a quick listen? Is that all right? Able to stand up, eh? I'm just going to have a little tap first, OK? Feel a bit warm, don't you? OK. Just have a wee listen down here, don't mind if I just... OK, that's fine. Have a seat. So, I mean, listening to your breathing, it's very clear. There's no sign of any tightening or asthma there. Your numbers are very good, and clearly you're struggling a little bit. And I just wonder if that's more sort of an anxiety, panic attack type of thing rather than a flare-up of the asthma. Our brains control our body, as you know, but sometimes they can sort of go into override, if you like. And certain things, sometimes for unknown reasons, can start making us feel a bit edgy and a bit anxious. And I think that's probably what's going on. Has anything happened today at school, or that's maybe could have made you feel a bit anxious and things? No. Yeah, panic attacks, they are very common. Much more common in ladies for some reason. Much more common in sort of your sort of age group, if you like, and it maybe is because there's a lot of changes going on, but also there's a lot of sort of emotional stuff going on and difficult to manage sometimes. There's a phone number we can give you that you can ring and you can get access to someone who can talk a bit about it. Would you like to do that? I think that's probably the best option, isn't it? All right, any questions from either of you?
Thank you.
All right. OK, we'll get you sorted, no worries. All right. See you later.
Come in. Hi, Mr. Arnott. Come in, I'm Dr. Khan. Come and sit down.
Nice to meet you.
How can I help?
So, Saturday, I went for a drink, went down to Tesco's, went to go buy some more beer. As I was down there, a group of lads ended up chasing me.
Right.
I must have done a good 5-6 miles of proper sprinting, running for my life kind of thing. I've really damaged both my calves, like to the point where I woke up this morning, I couldn't get out of bed.
OK, so now tell me about the leg.
I struggle standing up, walking around.
Yeah.
It's just, it feels like constant cramp.
OK, both legs or just one?
Both.
Right, and whereabouts?
Like, all my calf.
All along there?
Yeah.
And you ran for how long do you think you ran for?
A good 5-6 mile hour running for a good couple of hours.
And for a couple of hours?
Yeah.
Right. We'll have a look at your legs and sort that out. How are you feeling about what happened?
Paranoid. Really paranoid.
Yeah.
Oh, thanks, Vicky. Just what it was.
Where would you like me to leave it?
Could you leave it just there? It's going to look at me all morning and remind me of apple juice and remind me to drink.
You've not suddenly started passing stools into your pants?
No.
Is there any blood in your poo?
No.
Heidi's been having quite sort of mucousy poo.
And is it like watery or soft?
It's watery. It smells horrible.
Is like a child's poo supposed to be black?
Going to the toilet OK?
Going to the toilet a lot.
Not been any blood in your poo?
No. Are they hard, soft, normal?
Carry a bag full of poo.
Her poos are just not formed.
Hiya.
Guess what I got you?
Moppy.
Moppy.
Go in there. Come in. Hi, honey. Please take a seat. So my name's Dr. Eunice. I'm one of the GPs working here. This is Angelia and your mum?
My name is
Amber. Yeah, hi, Amber. How can I help?
She hasn't been very well. I think she complains a lot about stomachache all the time.
Where in the tummy are you having the pain?
In the middle.
And do you have the pain at the moment? No. OK. When was the last time you had the pain?
About 3 hours ago.
OK. When you go into the toilet, when you're doing a poo, I'm going to ask you some silly questions about poo now. Is that OK? When you're going to try and do a poo, is it hard to get the poo out? Do you have to strain a lot to get the poo out? OK. If I show you pictures of poo on my phone, if that's OK, would you be able to tell me which ones you have? I know it's silly, What sort of poo do you get when you do a poo?
That one and that one.
OK, so when it's this one tells us that you're a bit constipated, OK. Have you noticed any blood or anything when you wipe? Nothing on your tissue, nothing like that? No. OK. What's her diet like?
She eats fine.
What sort of food would she eat?
Mainly containing bread.
OK.
She likes paninis.
What about vegetables, fibre type thing? You're already saying no, very much. No, OK. Because I think that's part of the reason. So normally when kids are constipated, usually diet has a big control. So we need to make sure we drink plenty of fluids, but also plenty of fibre, so vegetables and things. Can we have a feel of your tummy? Would that be OK? Perfect. So if you pop up on there, and if you lie back down for me, honey, is that OK? So all we're going to do is feel your tummy. Is that it? That's all we're going to do. No pain at the moment? No pain down there? Bit of pain there, OK. That's fine. If you pop back down there. I think we're going to give you something to help with opening your bowels. So this tummy pain might not be, but it's likely that it's all related to this constipation that you suffer from. What we give you to help with that, we give you some medicine. But actually, the main treatment for it is going to be looking at a diet, make sure you're having the good type of food. I know they don't taste nice. You know, I was horrible when I was a kid with vegetables, but like now I know the importance of it.
Thank you ever so much.
That's fine. Thank you. Thank you. See you later.
Thank you.
OK, thank you. See you later.
Still got 2.5 hours left.
Who was?
Me.
2.5?
Yeah, but well, you know what I mean.
2 hours and 20 minutes. Every minute counts. So it's 10 minutes knocked off of it.
Once you're in the hour, it's a breeze.
Oh yeah, no, tell me about it. We've got a temporary registration patient coming hopefully soon.
I feel like if I press these, I'll shoot out of this chair.
Are Are you nervous about going out or anything like that? Have you been out since then?
No, I was going to get bus time. I couldn't even get bus time. I ended up getting a taxi and...
Yeah, it's a very stressful situation to have been in. I think anyone would feel nervous about going out after something like that.
Talking about traumatic experiences is really helpful. Mental health and well-being is so important, especially in young men. It's just as important as your physical health. Evidence suggests that young men are most at risk of suicide. So if you are feeling troubled, down, anxious, please come and see your doctor. We're here to help.
So your legs and the difficulty with your legs, that's easy for me to take care of. It's how we manage the kind of the impact of being chased by these people.
It's paranoia, like there was someone who knocked at my door today and I wouldn't even go open the door.
Right, right.
Just because 2 months ago I ended up getting robbed at knife point.
Oh, God. Have you had any support kind of through these incidents that have happened to you?
I've done like therapy before. I've been on like all the antidepressants and stuff like that, which in my opinion I don't think they do anything, but...
They don't work for everyone, you're right. And if you've been through an awful situation or you're going through an awful situation, they can never take that away from you. I think there's more going on under the surface. We do have a fantastic counsellor here at the surgery, and she does talk to you back as well as listen. The first few appointments are about listening and getting to know you, but then after that, it's about talking about how to cope with things and how to manage things better. So why don't we arrange to see each other in a couple of weeks after today and make sure that side of things is settling, and if not, we can think about how we manage that.
Yeah.
Let's have a look at your legs. That's what you're really here for, isn't it? Okay. So...
Give me a second.
No, take your time. Right, so if you just lie down on there for us. I'm just going to have a feel of your legs. Is that sore?
Yeah.
Yeah, they are very tight, aren't they, your legs? Okay. What's happened to these muscles, really? It's just because they're not used to that distance of running, as most muscles aren't. They've become swollen and tender as a result. We need to give you something to reduce all this inflammation down. Okay, I'll sort that out. Just come out when you're ready, Simon. I think there's a lot of positive things about you, Simon. I was just thinking about it. You're a young lad. You've been through a lot, you know. It's difficult things to talk about, but, you know, you've talked about them, and I think that's really important.
Yeah, it's hard to speak to my mum about stuff like that, and because she'll worry more than me. And
does she get worried as well?
Yeah.
As mums do, eh?
Yeah, and I don't want my mum getting more worried than I am.
Yeah, I think that's fair.
There's no point putting pressure on her, is there?
You're a nice lad, Simon. Oh, don't forget this. This is the key to your legs getting better.
Thank you.
All right, see you in a bit. Bye.
Wonderful, thank you.
I can keep hearing, like, you know, beep noises.
Not sure I can see anything. It's there, right on the there, so it's there.
Sometimes in the middle of the night, it's like drum beats. I can hear this dum 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 dum, and then it stops.
Right, I'm Dr. Caris, and we've got Karen knocking around.
Yep.
So...
Sorry, what's your name?
Dr. Caris.
Carey.
Caris.
Kelly.
Caris.
Carey.
Toe your doctor mentioned. Toe your doctor mentioned.
Yeah, I'm not... No, sorry, yeah.
Sorry.
Come on through.
Thank you.
Have a seat, Mr. McGowan. So my name's Gemma. I'm a physician associate student working with Dr. James this morning.
Right.
Are you happy to speak with me first? And then we'll get Dr. James in. Is that OK?
Yeah, sounds, yeah.
Perfect. So how can we help you this morning?
Well, I've gone deaf in this year. Probably about 70% deaf.
OK.
I think I'm bunged up. You know, whatever the word is, congested.
Yeah, yeah.
That eye's watering as well.
Runny nose?
No, blocked.
Blocked nose as well?
Yeah.
Are you happy for me to do a few examinations on you today? Is that all right?
Yes, love, yeah.
So I'm just going to start by taking your temperature. So just going in your ear. Go in the good one. Perfect.
Is it?
36.3, that's absolutely normal. Right. I'm just going to go in the good ear first, if that's all right.
Yep.
And on the other side. Tell me if it's uncomfortable or painful.
No, it won't be, love, no. Won't be. No, it's not.
So when I summarise to the doctor, it's the ear that's concerning you most, isn't it?
Even though it's me, and it, you know, like if I go like that.
Yeah. That's what it feels
I
like.
can hear that inside like a right loud noise.
I'll go and knock. I might be a few minutes if he's just
Yeah,
seeing
it's
someone,
all right.
but he'll come back in here with me.
I can nod off, can I?
Yeah, have a sleep if you want. Right, thank you.
Okay.
Um, 69-year-old gentleman, Mr. McGowan. He's come in with 3-week history of gradual hearing loss in his left ear.
Okay.
It's sounding quite like a viral infection. He's got a bit of a stuffy nose, feeling a bit under the weather. Sorry for the wait.
Hi there.
Hello.
It's Dr.
All right.
James. Nice to see you.
All right.
So I understand that your hearing's been down a little bit.
This one, yeah.
Is it always in that one?
Yeah.
Sometimes if you're blocked up in your nose, there's a little tube that runs from your sinuses to your inner ear, and that little tube is blocked up.
Right.
And that pulls the eardrum a little bit down over the small bones of the ear.
Right.
And then that's probably what's caused your hearing to drop down.
Yeah, right.
And it'll probably stay dropped down until this clears.
Right.
So it might be 4 or 5 weeks.
All right.
Altogether. Can you breathe in and out?
No, this nose is... I can there.
It's really blocked,
Not
isn't
that
it?
one, yeah.
Have you broken your nose before?
No. Not that I know of.
It's quite inflamed and a bit angry on that side.
Right. In the past, when I've had it similar, I put my head over that albus oil in water.
That would help, definitely, what you just described. The other thing is a nasal spray, so I'll give you a prescription for that, and that
Right.
should open it up.
Right, right.
Well, I'll go and do the prescription. I'll take Gemma with me, I'll go and sign it, and she can bring it back for you.
Okay.
Is that okay?
Yeah, thank you.
We'll see you in a second.
Yep.
That's fine. That's good. Yeah. I think hit the nail on the head there. A physician's associate is something that's been used in many different healthcare systems throughout the world to really good effect. They primarily support the clinical team, and that might involve seeing acutely ill patients on that day under the supervision of a doctor, helping triage or work out who needs to be seen most urgently, and also helping us manage some of our complex and chronically ill patients alongside the doctor. This is likely to become more normal in the future.
Right, here we go. Sorry for keeping you so long.
Okay, that's all right.
So this is the nasal spray. It probably will take about a week or so to start feeling the effects.
Okay, look.
And if after a few weeks you're still exactly the same, no better, do come back.
Right.
Is that all right then, sir?
Yes, love. Yes,
Thank you very much for speaking with me. Sorry we've taken
Okay,
so
look.
long
No,
today.
it's all right. Thank you.
Take care.
Bye. Bye, love.
Number 17. You're both together, aren't you? Yeah. Can I just take a brief indication as to what the problems are today?
Mine is for a repeat prescription, and also I'd like to see the doctor about the pain I'm suffering, because I'm like it's a constant 24/7 pain.
And mine's for sick now.
So I can get you both seen together if you can either sit and wait until 10:20 or come back for that time.
Yeah, we'll come back at 10:20.
Yeah.
Can you wait on a
I will.
Yeah. We'll live across the road 5 minutes. That sounds good. Similar like a sit and wait. And
Yeah, we did used to do sit and wait many years ago, but we decided to change because it was just too busy and not everybody was getting seen.
Well, where we used to live, they still do the sit and wait.
Yeah, you see, we're a very big practice, you see. We've got over 23,000 patients, so if we did that, you can imagine how busy it would get. Lovely. So that's both your appointments this morning. You both be seen together, OK? Yeah.
Okay.
All right, no problem, thank you.
Here we are.
Hi, come on in.
Sorry, they kept me up there.
Oh, I know, that's why we know there's a bit of a queue sometimes in the morning. So, it was this thing here, wasn't it? Would you mind if I just refresh myself? OK. Right, OK. So we've done thank you for that. We've done a biopsy.
Yeah.
It's come back as a little bit thicker than we would have, than I initially thought.
Yes.
So the plan today is to remove that completely.
OK.
Just show you. From what we can see, if it's that sort of area, the current guidance is we're to measure 4 millimetres in all directions, and then we remove all of that to a cuff of healthy skin.
Yes.
OK?
Yes.
Right. Right, I'm going to draw on you now, OK, just so we can get the boundaries.
I have to say, it's better than going to the dentist, this.
Yeah, I agree. Right, OK, grand. Right, here we go.
Little sharp.
3, 2, 1. Skin cancers can appear in various different forms and often in their very early stages can be hard to spot. Sometimes they can be just a small pink mark that doesn't settle or a scab that doesn't heal. In Barbara's case, she didn't have a scabbed area or a non-healing area, but it was clear to me once I'd looked at it down in a dermatoscope that it was cancerous and needed to be removed. If a patient is concerned, then they must go and seek medical advice and get checked over.
You're doing really well.
So at the moment, I'm just doing the deep layer. Would you like one of my tomatoes? Do you like tomatoes?
Yeah, I do.
They're really nice. I think they're really nice. Have a couple.
Small, isn't it?
Yeah.
So how do you practice doing stitches?
On an orange. On an orange, you make a cut in an orange
And
then stitch it back together. Yeah, that's what I used to do.
So when I first saw those 3 little red, almost like pinpricks, how long would I have had this growing?
Well, it's a spectrum, really. It sort of starts off at some sun damage where the skin just doesn't heal particularly well. You get these little marks, and then you start to get little red or white marks, and then those can sometimes change into these things. Right, 5. What do you think, Karen? We're all right there, aren't we?
Well, I need the mirror now, you know, like you do at the dentist.
We haven't got a mirror, have we?
I'll see it when I take the dressing off.
Yeah, I'll just leave it like that.
Thank you for that.
No, you're most welcome. Any other questions?
No. I think
Right,
that's fine.
I'll leave you in peace to get yourself sorted.
Thank you.
You're most welcome.
Come and have a seat. I'm Becky, one of the nurse practitioners.
Hiya.
Hi, I think we've met before, haven't
Yeah.
we? Yeah. Hello there. What are we doing today?
It only happened yesterday. She was a bit chesty.
Yeah.
And then last night I was watching her breathing. She was struggling, you know, like breathing really badly.
Okay. And she went in hospital, didn't she, last
Yeah.
year, did she, when she had bronchiolitis then?
Yeah.
Can.
She's got a high temperature, so I'll give her Calpol at 7:30.
Okay. Are you clapping? Are you clapping? Hey. And has she been coughing, runny nose
She's
or
had
anything?
a cold for about 2 weeks.
Okay. Right, sweetheart. Do you want to start getting her undressed and have a little look at you? Right, we'll listen to your heart, aren't we? Hey, I'm gonna pop that there.
No, it's...
What's that cough been like?
Barking.
More like a bit of croupy cough, really. So we're going to give her these tablets now, and then we're going to repeat it in 12 hours.
Right.
So do what you're doing. Paracetamol, ibuprofen, lots of fluids, wet nappies and things, OK?
Yeah. Right, that's fine.
Yeah. But we'll see what she's like this afternoon, and then we might just have to see her again tomorrow as well. Just
Yeah,
to make
that's
sure.
fine. That's
Is that
totally
all
fine,
right?
yeah.
OK, I'll get door for you. All right, sweetheart.
Thank you ever so
We'll
much.
see you later on.
See ya.
Bye-bye now.
Sylvia, please. Hiya, Sylvia.
Hi.
Come through. Come in, Sylvia. Please take a seat.
I'll have to take my coat off. I'm absolutely cooking.
My name's Dr. Eunice. I'm one of the GPs working here.
Yes.
How can I help?
But I cough and cough and cough. And then the sneezes come. It's uncontrollable. I can't stop it.
There's a lot of different causes for cough. One of them is an infection.
Yeah.
Can we have a look? I think
Yeah,
that'd be
of
the
course
best
you
thing.
can.
So let's check your temperature first whilst you're seated. We'll check your temperature and your oxygen level. And then what we'll do is we'll have a listen to your chest.
Please.
You've got beautiful earrings on, or studs. 36.8 temperature, that's fine. This tells us how well you're breathing. So your oxygen level at the moment, 98%, which is very good. And your pulse is 67, which is perfect as well. So what we'll do is we'll pop you on there, flip up the curtains round. We want to have a listen to your back and I want to have a listen to your front. And if you just take a deep breath in and out through your mouth for me, honey. Gonna tap on your chest. That's okay. Can I have a listen to your front as well?
You can.
Do you want to pop up behind the curtain for me, honey?
I'm just kind of coping because I lost my husband in end of May.
This year?
Yes.
Oh.
And he'd been in hospital before, you bring them out. And this time he went in and he didn't come out. So it was
Must have been
a
a
bit
shock.
traumatic. Yeah, it is a shock. He had internal bleeding. And obviously heart failure at the end, of course.
It's horrible losing a loved one, isn't
is,
it?
yes.
And I think nothing can sort of replace that bond.
No.
How about you in terms of friends and stuff? Are you getting out?
Well, I do some voluntary work. I've done it for coming up to our 12th year.
Mm-hmm.
There's a church thing that has babies and mothers and carers come.
Good
they come for
like
an hour.
a huge community, isn't it?
Yes,
Yeah.
I worked as a nursery nurse all my life with
okay.
children, small children. So I've been very fortunate.
In terms of your chest, when people are coughing and coughing for a long time, I want to make sure that we've had a recent chest X-ray just to make sure that
No, I haven't
that all
had one for a
sounds
while,
okay.
yes.
So I think let's get a chest X-ray
Yeah.
done. Listening to your chest, I can't hear signs of infection. No. And your oxygen level was 98%. You know,
good,
all of
isn't
that
it?
is very good.
Yes.
Yeah. But obviously,
Good.
if you do start bringing up the phlegm that you can see, or
Yeah.
things are getting worse, we want to see you again. But right now, touch wood,
That's lovely.
you're fine.
Oh, that's lovely.
And I hope it continues that way.
Yes.
Is that okay?
Oh, that's brilliant.
It's lovely meeting you. I'll pop this on. Do you need any help?
No, I'm fine, love. It's just I'm careful with this shoulder. It's a pleasure to meet you.
It's a pleasure to meet you.
Yes, and I'm very reassured with that.
You are a delight, Sylvia, honestly. Pleasure to see you. I'll leave an X-ray form out in reception for you.
Yes.
Out that way and down.
Thank you, dear.
She is lovely.
Take care.
Bye.
Thanks. Bye-bye.
Thank you very much for your help.
Cheers.
Take
You
care.
take care.
Bye.
Thanks. All the best.
Thank you. All right, see you later. Bye-bye.
All right then, thanks
All
a lot.
right, take care now. Bye-bye.
It wasn't empty that time, was it?
No, you're an awful girl.
Which bit do you think you find the hardest?
Everything. You just want everything to go away.
At my age, you know, you can't leave things too long in case you pop off in the meantime.